We request you to take your seat. Parade peke yake. Nyuma zgeuka. Kwa mwendo wa haraka na haraka. Sakat mbele, tembea.
Take a tire. I think we can stop it at that level. I request the DHO Kazo to come here. DHO Kazo. DHO. Nani mashabangu tuterere aba UPDF brass band mu ngaro. Kandi munchirize abanyakazo tukolese umwanya wo gutwakira umugeni wetu mukuru Dr. Diana Twine, permanent secretary wa Ministry y'Amagara ahabo kwija kandi kwese umugoro gwete kitinisi. Tumuterere ngaro zamani ntumwakira. Twakwakira umugeni wetu mukuru yabare kwija ati aiteme twaza kukoratsaho tutakagire mbindi byona nsakushabo umugeni wetu mukuru n'abagenya abana MPs beitu agende ayebemberwe kao na DHO aze kurambura ibariyo baragurira abantu. Then thereafter we shall proceed with the program. Necho ninja kushaba ba Kazo Secondary School umugeni mukuru yaba narambura kuriya mwijembe n'umutuhereza entertainment. DHO read the guest of honor. Kazo Secondary School. Then thereafter we shall call St. Catherine Girls. NPC tekataire ntukurisia function ya waha. Nubona iza kureba ba patriots ni ba commanding ngama yegihanga. Twino musirikare wetu ari mu department yo bwegese nibamweta Captain NPC Tekatahire Robert n'umusirikare witu wa district so nwakuturinda umbikwatereine nebyo bwerinzi bwa district. Kazo Secondary School.
Diagram Simple Production. Ega kweba zele mukama pinwire manzi. Utenderezwe debonyizwe byanzi. Alright. I thank you for your blessing, for your mercy and the money. Images overloaded, now we're shining in the party. Amashemera ngijune yayende funde. Abaguzi bishuze dukaza kama simwe. We going from local to international this year. We never gonna borrow, now we balangolo this year. Yeah. We going from local to international this year. We never gonna borrow, now we Simple Production.
katuterera abana ba Kazo Secondary School mu ngaro habwa that entertainment. Katwakira ba St. Catherine Girls Beijaha nabo babene batu entertaininga mjenyi wetu mukuru yaba narambula okuba riyo baragurira abantu beitu, and I request abantu mwena Beijaha ngo esha yo norebe ngwara bahariya wagire cyo wakebeza tokamanya no bano teka ngo orije obundi shukari obundi chi no shanga bagira ko bakwata mukande ka kuyamba okweyongera ibiro byawo munsi nambweno nyowe ninya nabanza yoko kuraguza ndeka ngo ine chikwija kunyamba. So this is St. Catherine Girls.
Ladies and gentlemen, this is St. Catherine Girls Secondary School. We are here to recite a poem which is entitled Know Your Hepatitis B Status. Just wait and watch.
At the feet we died, we shed tears, all that because of you, Mr. Hepatitis.
I request you to hold on. You recite your poem when the chief guest. I think it is very important for the chief guest to listen. No be there, just on standby. Twabakira mjenyi wetu mukuru twakwakira kuruka yoko n'abagenyi betu mwena. Our chief guest before you, these are young ladies, girls from St. Catherine Girls Secondary School here in Kazo. They are ready to receive you. Proceed.
Ladies and gentlemen, this is St. Catherine Girls Secondary School. We are here to recite a poem which is entitled No Hepatitis B Status. Just wait and watch.
At your feet we died, we shed tears, all that because of you, Mr. Hepatitis.
You invade us via an infected mother to the newborn during birth, body contact with blood of an infected person, unprotected sex with an infected person, and unsafe blood transfusion.
Mr. Hepatitis, we shall never die at your peril. We have discovered all tricks you use. You will never and never attack our liver. We have known you don't reveal your signs and symptoms easily.
Ugandans, especially Kazo dwellers, let's fight hepatitis disease. Let's test and know our status, vaccinate children at birth, avoid body contact with blood, deassociate ourselves from multiple unprotected sex. If positive, seek medical treatment. Ladies and gentlemen, let's stand together, fight this deadly disease through sensitization and vaccination.
The guest of honor, the area MP, the RDC, the chairperson LC5, all protocol observed. Ladies and gentlemen, good morning. The poem we have just recited is about a deadly disease known as hepatitis. It is very dangerous in a way that it affects us unknowingly. First and foremost, it is caused by a virus known as Hep B. It is spread through having sexual intercourse with an infected person, through direct blood contact with an infected person, and at birth. Also, it can be prevented through vaccination, sensitizing all the masses, and avoiding direct blood contact of an infected person. Thank you. St. Catherine Girls, Education for Life, for God and my country.
Aba St. Catherine Girls Secondary School, mwebare munonga. Yo hepatitis bagiye tomusheija obana amazima bashaho baza kutugamba. So mjenyi wetu mukuru twakushemerwa. Yebare kwija kutayira Kazo kandi na ministry yanyu ya health okutwikiriza nga Kazo district ka hostingo mukorogu nekintu kyamani nishabanya Kazo mutero mungaro. Nemikoro miche ya national yitu nk'abanyakazo yitara hostingire konka mbwenu ntubasima abo kutuhereza this opportunity. Omugeni wetu mukuru aha tineho ba members bitu wa parliament wabarebere konka nintegwa kubanjira ngo abantu babo babarebe. Twine honorable Jennifer omukyara urukujwekera abakyara abakazo parliament yihanga. Twina member wa parliament omusheija honorable Dan Chimosho owe byamagara nebikorwa. Twina chairman wa LC5 Reverend kandi omuwike hwire bamuhire cha doctor Mugisha Samuel Katugunda. Ngwariyo nafana cha professor ombindu byobutegeki. Twakwakira chairman. Twina RDC Captain Yaya Kakoza is our RDC. Onchirize nkwanjurire Chief Administrative Officer waitu wa Kazo Mwami Nsubuga zirimenya ali wano. Ekitwekeje kiturumu mjenyi wetu mukuru nibageta Kazo Town Council. Obuturi aha twine meya wa Kazo Town Council Justice Mugarra emerera bakwakire. Omukategori ejo nishabangu twakire ba LCs chairperson zabari aha mwemerere omugeni wetu mukuru abarebe. Owengari, owa Kanoni, owa Kazo, owa Buremba, owa Champangara no wa Mijina. They are all here. Omugeni wetu mukuru twine councillors ba district barwaha na ninshaba ngumwemerere omugeni wetu mukuru arebe nguru ya turiyaha kandi twamwakira. Bariyaha arona host councillor omwanyogu umucyara Leya Munene niwe deputy speaker wetu ariya. Twine abo bukiko bwa NRM bariyaha na mbashabangu executive ya NRM ya district mwemerere ndeba registrar bariyaha nabo bakwakira. Twine clergy, twine counter sheikh, twine muri sawo buri sobu bona bariyaha mwemerere. Mjenyi wetu mukuru twine ba staff ba district eje ya Kazo umukoro ogu bo bariyo bagukora nimbashabangu mwemerere wakira mjenyi wetu mukuru abakora na Kazo district local government. Nari baba headmaster baguma basitame wa Mizirimenya, I will tell you, make sure they don't get salary this month. So twine community yone ryaha twizere kukuza ikireki no kugira amakuru gutwatunga kandi ninja kushaba mugenzi wanje umugambirizi w'ekitongore cy'ebyamagara mwamenya nabyona neja kutwanjurira abakorwa ministry y'ebyamagara. Then we shall proceed. So ainabyona then tukatandika omukoro guntumanyana and saving the time abokuba abantu abandi bari aha nibenda kuza kuraguza.
Webare mnonga MC twabakira mwena okuruga mu ministry y'ebyamagara twine abantu aba mu bitinisa byabo. Twija na Mr. Kenneth Akiri, Under Secretary mu ministry y'ebyamagara. Twine Commissioner Health Promotion, Education and Communication, Dr. Richard Kabanda. Twine Commissioner Community Health, Dr. George Opentho Dugum. Twashuba twagira na Dr. Herbert Nabasa, Commissioner wa Environmental Health. Twine Commissioner Dr. Ronnie Bahantunjire, in charge of community clinical services. Twija na Dr. Michael Mbaganizi, Program Manager wa UNEPI, kandi niyeri in charge okusirika obugwire. Twine na Dr. Rita Atugonza, Deputy Program Manager UNEPI. Twine Dr. Rachel Beagira, Hepatitis Focal Person, Ate is also in charge of adolescent and school health. Dr. Rachel, mukutegeko mukoro ainemo mukoro gwamani, omukono gwamani. Twija na Dr. Fred Nsubuga, Senior Medical Officer UNEPI. Twija na Mr. Jimmy Amen, Gavi Coordinator. Twija na Miss Dina Kwarisima, SBCC Specialist Global Fund. Twija na Mr. Joshua Musasizi, Senior Policy Advisor. Twashua twija na Mr. Ivan Chigude, Personal Assistant to the PS. Sister Cheptoyek Emily, Principal Nursing Officer. Sister Doreen Akuno, Senior Nursing Officer. Mr. Edward Basenge, Program Officer in Community Health Department. Kandi na Department ekukulira ebya laboratory no kuchebera twija na Dr. Sewanyana Isaac, Laboratory Director. Mr. Ogok Patrick, National Quality Assurance Coordinator. Mr. Sula Ikova, Head of Operations. Dr. Aisu Stephen, former Head of CPCR and member of the Laboratory Technical Committee. Ms. Viola Kasone, Laboratory Technical Officer, Hepatitis, CPHL. Dr. Linda Nabitaka, AIDS Control Program, Senior Program Officer, Prevention of Mother-to-Child Transmission. Then Ms. Diana Kagere, PRO CPHL. We also have Professor Ochama, Gastroenterology Society. Okay. I'm also informed that Twine Commissioner, National Disease Control Department, Dr. Tusime. We also have a team from the National Medical Stores. We welcome you, representing the General Manager. From civil society, we have Emmanuel Rutamaguzi, who will also be speaking as a hepatitis patient from the civil society. We also have Dr. Kagwa Mugaga, representing the country representative World Health Organization. Mwena twabakira ha mukoro gw'erizoba kandi ninyenda nyete chairman LC1 yashikire hanoya.
In that case, tuja kukolesa meya wa Kazo ija oyakira abantu mu kifeka cyawo.
Omugenyi wetu w'erizoba na timu yawe wijana yiyona member of parliament sabaryaha the RDC n'abantu bona all protocol observed abukuba abantu bona babanjire iza kutwara umugisho kubanza kusima izoberi kandi okusima government kureba ngo yabasa kuturi organizing nk'abanyakazo kandi yatuhereza izoberi ya hepatitis kuruzi bo muri Kazo. Nyenda abantu bona baryaha tubanze terero mugenyi wetu mukoro omungaro amazima tukusima ombwire bwawe nko mugenyi mukuru okubasa kureba no organizing Kazo nayo na member parliament beitero mugezo kureba twabasa kubaha kandi twakorezaho ikireki cya national ukugeba ngo abantu bona barya tutwara umugisho gusima timu y'imuteyire itubase kwatanisa nayo omukutebekana so mukorogo twara umugisho gusima district ebembero cya person LC5 otwetsere Dr. Hati Dr. Weitu na member parliament bona nangwa na timu ya district na kawo na RDC okuba omukoro gutwireho twagezaho twarwana nago konkani mpamyango riza twatera muhero omurimo gwanjaha bakuriyo kwakira abanyakazo kubakira aha ukubasa kuzo omukorogu mwahura no gwa hepatitis B abantu bengi batwire nendwareji na sima government okubasa kwijika kandi ukorene kuzizobera kuko esenero kuza okuba endwareje twireho nyo ekyo kubanzanya nabantu nka abariyo myaka nka 17 abayene bazaherwa akaba testinga hepatitis B oshanga aine myaka 20 bindu kumanya abagine konka abantu bino kutina kwango munonga ijo kutwagira mu radio nibagamba hepatitis B bagamba ngute kukira hata abantu bingi bagira kutina jya tatendwa leta kukira naza kugicebereza no manya abantu bingi no batina wakurra ngo endwara te kukira yagiceberezo mbantu wamanya ngo agine na naher koraba kwata uzakorena garra bigere nyuma bwana nisha wabanyakazo hepatitis B haina abantu binkumanya be 20 years with it nimbashaba murebeke ngo mwagenda mwakebeza uwayemanya watwitinga magaragawo embazeroho government giteyire buri kimwe cyona ne kikora murebeke ngo mwagezaho inza kutwara umugishogo umyenyi wetu mukuru kubanza kugambira kandi no kusima nisime mbazi yirwaro eyimukutereza abantu barije konkate kumara pireka challenge abantu roshanga baterera yini yese ntumanye byabusha bitahora ino mpango konka kandi ntubashangwe mbaze yongereho mu marwaro abantu roshanga basafaringa bahikaye mbazo shangeta kubasa kumara ntukushaba utuberi iraka nko munyakazo twahirira uru munyakazo embazi yitu umuyihanga ryona ebase kweyongeraho namba kabiri twinirwaro ryita tukusima mnonga abo kwasa kutombekera ward zezero twina matene ward zibiri kandi nsima na UPDF brigade erukombeka etukorero mu muhango mnonga utwaro kusima kwitu okutikizeyo okuba nekoro mu murungi kandi ntugisima ntukusima abwe muteira konkato antishaba kwa kuba hariyo uko kubasa kutiyamba irwaro ryito ndishaka munonga turukomere turonde bitimba twasa kurukoma turitebekanise mutiyamba ho hari iki irwaro rero warishikaho ninjango no kwana warabayo turukomere ngende bitimba kurenga ryatebekanisibwa na nebindi report sezindi ezikwetenge sezer inside abirwaro nobeje kuzikushobora na cya person LC5 in report mpango yakuza ku presentinga aha byo kubasa kugira ngo watiyambaho nebyo nimbasima abanyakazo feeling at home. This is Kazo hikize myaka 3 nka district konka ningira barabamu mwarebo ngo there is an improvement kandi rien tukora tutishitami nk'abanyakazo mukama twatse tubase kugikora tugitebekanise nkabebe mbeze kama wita simu amazina Justice Mugarra muhimbura meya Kazo Town Council kandi omuzaro wa Kazo oba kweta meyo weitu tubakunyeta eri nbanyeta meya oweitu mukama simu
kare meya wa Kazo yobare yawe bigambo byawe mjenyi weitu mukuru twashemerwa omwana weitu otukuzarwa nawe anda sekretary wawe kandi no obi wishomereri ndeba yiwashomera kirire nanje nangu mbanjure anda secretary aba ministry ba mwanjura nawo ndio ni mwanjura mu capacity nko munyakazo kandi nko washomeira mwami akiri mukabanda wabagorebe abakazo secondary akachiko mwete ngo mushiya jete witafari. He was the best student in 2000 here at Kazo Secondary School senior 6 results. He was the best, so akiri twakwachira mbwenu ojota ya irishomero yawe umanye bikufaho na naba Magondo akashomera na Magondo itwenga district Magondo tukajihereza model school tubiye bine bityo ntukoraho konka tukusima ebu watwatse konko yongereyo next twaza kura district health officer atwereze status yebyamagara nebindi omu district ya Kazo kwararjeyo ntuja kura mukuru w'abakozi mwami Nsubuga zirimenya they are one because no head wa technical. Thereafter we shall have entertainment from Murtaba.
Thank you so much, MC. Our guest of honor for tonight, the area MP, woman MP, all invited guests, protocol observed. I'm called Dibule Esther, the Assistant District Health Officer, Maternal Child Health, Kazo District Local Government. Madam, guest of honor for tonight's occasion, I would like to briefly talk about the background of Kazo District. Kazo District is one of the newly created districts. It was carved out of Kazo, Chiruhura District Local Government in the financial year 2019. Now it's 4 years operational as a district of itself. Madam PS, Kazo District has 6. Kazo District Local Government, we have 10 sub-counties, of which 2 are town councils. We also have 51 parishes and 346 villages. And in this district, it has a population of 232,000 as per the financial year 2023-2024. It has a demographic population of 232, that is the total population. The children below 18 years, we have 128,163. And the adolescents, we have 80,945. And the children below 5 years are 47,683. So in interest of time, it has staff levels of 75% at the health department. This district has health facilities, both public centers, which are 19. Then we have 3 PNFPs and 9 private for profit. in which we have one health center 4, which acts as our district referral center in all the services. It has operational theater. We have blood transfusions services and also other services like the art services. In these facilities, all the health center 2, 3, and 4, we offer immunization services to our communities, and we also have delivery services, that is MCH and reproductive health, including family planning. Apart from the center 2s, we have all our center 3s and 4, plus the 3 PNFPs, which offers art services. Then on our theater services, it started working in 2019, and the numbers were low, but as I speak now, we have an average of cesarean sections of about 26 in a month. And this facility is only managed by one medical officer who handles all the cases, practically serving the patients and at the same time administration. And also the blood services started with the 21 units. That was in 2019, but as I speak now, we are having a high demand of blood transfusion, where in 2023, we had reached to about 347 units of blood being transfused in Kazo Health Center 4, which acts as our referral facility. Madam PS, I would also like to inform us and the older crowd here that in the district, we have key issues which are pertaining the health of the community of Kazo. We have diseases which are ranking very high in our facilities as cause of morbidity in our community. The first one is the malaria, followed by flu and cough, which are both on the under 5s and the over 5s. And the mortality rate in our communities or Kazo district is mainly contributed by hypertension. That means the non-communicable diseases are already taking lead in our communities, and yet most times we are focusing on communicable diseases. So I'm calling upon the community of Kazo district with the help of the PS to give us hand in that area, because hypertension and DM, that is diabetes, is coming a problem in our communities. Then also, Madam PS, on the aspect of hepatitis as being the key for the celebration of today, in our district, we have the statistics which are pertaining hepatitis B. In 2020, we had positives of around 195,000. Then in 2021, for example, it had dropped like to 41. But now we are seeing a stiff rise on hepatitis infection, where we tested 3,373 cases or patients, and we got 606 who turned to be positive. So that is a very high numbers according to our population of Kazo. And already in 2023, this year, which is not yet complete, we've already reached our positives of 246, which is also very high. I think by the end of this year, it may be more than this. And that's where I call upon the communities, because hepatitis is preventable. We have to ensure that our community really takes the charge of bringing our children, because the hepatitis vaccine is included into our routine immunization vaccines. That means if we really have a good coverage of immunization, then we shall reach there in preventing our community. Madam Guest of Honor, I take this opportunity also to thank you in supporting the district together with the Ministry of Health in many aspects in improving the service delivery and the quality of the care for the community of Kazo. We also work together with the VHTs. In each of these villages, which I have read the number of 346, each village has an average of 5 trained VHTs who offers all services pertaining health, that is mainly sensitization. Then also they do counsel and refer where necessary these community members to our health facilities to seek services. And also they do the same in linking these patients to the CSOs, which helps or which are working together in collaboration with the Kazo district, local government, the health department. And in this area, in most work the VHTs do, mainly in also mobilization of the communities on immunizations and other government activities which are related to health. Madam Guest of Honor, with all those, we also have outreaches, community outreaches, because we have a problem of long distances in our community. You find that, for example, the distance from the community to where services are accessed, it's some are 15 kilometers away, which is very far for these clients to come to seek services. That's why we have the strategy of outreaches, and we carry out integrated services to our communities through the outreaches with our VHTs. In the same note, I would like to also address the challenges that we have in the department. In addition to the long distances, we also have casual laborers in Kazo district, where they come during time of seasons, and after that they go back where they come. So you find that sometimes it lets us down in our service delivery to give a complete package of especially immunization to our children. Then we have a challenge mainly, we have lack of medical and medical stores in storage of our medicines and medical supplies. Madam PS, we also lack a district vaccine stores. You find that as humans we breathe, also the EPI storage system, those are the fridges, need a breathing space. So as I speak now currently, we are using a small room which is in Kazo Health Center 4, acting as our DVS, which is small to accommodate the equipment of cold chain. Also, in that note, as I stated before, we have a lack of a district hospital. As we saw the statistics, there is a high demand for specialized services within our district, of which they can't be offered in the health center 4, not until we have a district hospital. Then we shall be able to handle some of those specialized or those other cases which need special care. So with all that, I would like to thank the guest of honor for today and all the invited guests for coming and join us on this day of the commemoration of Hepatitis B celebration or World Day. I thank you so much for God and my country.
Thank you very much, our DHO Kazo, for a technical report and about Kazo district. I now call upon the Chief Administrative Officer and then Mr. Tava, cultural dancers, you prepare to present.
Our guest of honor, the Permanent Secretary, Minister of Health, and members of Parliament, the District Chairperson, all invited guests, ladies and gentlemen. Several guests, Madam Guest of Honor, Chairman yanzikiriza nti njogerengako mu Luganda, so nzikiriza nkwanirize mu lulimi olwo ku lwa bannange ab'emijina abagala okuwulira mu lulimi bwe lutyo. Njina ebintu bibiri ng'ekisooka kwebaza. Njagala okwebaza ne Ministry ya Health olw'obuyambi bw'otuwadde nga district mu bintu byonna. Nkakasa Chairman member wa Parliament bajja kubyanja gy'oli, naye nzikiriza nkwebaze generally olwa support Ministry gy'etuwa ne ttiimu yo yonna. Nzikiriza njogere ku bintu bibiri bye njagala otwale ng'omukulu w'abakozi. Ekisooka, tuzimbye health facilities eziwera nga 5 ezeetaaga abakozi. Ebyembi facility tetulina wage, so challenge yaffe ya inadequate wage recruiting aba staff mu ezo health centers empya. So njagala nga ministry tuwandiikidde Ministry ya Public Service ne Ministry ey'ebyensimbi, naye nkakasa twetaaga eddoboozi lyo okulaba nga wage yetugifuna sobola okukozesa facilities zetuzimbye. Ekyokubiri, gavumenti etuyambye ne ministry yo okuzimba amalwaliro, naye tukyasigazaayo sub-counties zaffe 2 esana bafuna health center 3 era nga ze Mijina ne Kazo sub-county. Ezo mpya so tezaaliwo mu assessment eri yakolebwa ku health center 3 so tujja kwetaaga obuwagizi bwo okulaba nga nazo zifiibwako okupgradinga facilities zeziina zituuke ku health center 3. Ekyokusatu, Madam PS, ye issue ey'okwekwipinga health center 4 yaffe. Twagala okwebaza obuwagizi n'omulimu ogulambudde n'ogulaba, naye tetulina facility oba nsimbi za kwekwipinga maternity empya. So tujja kusaba obuyambi mu line eyo. Kisembayo tulina challenge, staffing level yaffe is standing at 72% mu health sector. Naye kyetaaga support. Challenge tusinga okuba nayo kwe kufuna ate akulira abakozi bonna DHO. Tugezezzaako okulanga emirundi ng'esatu nga tetufuna muntu asaanidde okukola nga DHO. Naye tuwandikidde ministry eyo ne service commission okutuyamba okwidentifyinga omuntu afitinga okukulira ttiimu eyo. Nga bwe ngambye olunaku si lwange, lunaku lulwo n'abakulembeze, nzikiriza nkome wano n'okubaagaliza olunaku olulungi mu Kazo eyeeyagaza. Mukama abakulembere, mwebale nnyo, mwebalire ddala.
Rutaba cultural dancers come for entertainment. I want to take this opportunity to recognize the DHO Chiruhura. Dr. Kamia is here with us. He's our former DHO when we were still Chiruhura as a district. Rutaba, where are you? Come over. After Rutaba, we shall Kazo Senior Secondary School. They have something to present. You have one. Mjenyi wetu mkuru yabari mnonga tuonjera kusima abyo twatse nka district ya Kazo. Abo kuba emwe babigambaho emwe chairman ajja kubigambaho. Twatse mnonga kandi kusima kandi tusima bwongerwa ahari ebye bitaka hoire tukushaba ngo mwongere kutwatsa kale Rutaba ubwo Rutaba no munyakazo itwe tukoresa products zaitwe za Kazo kandi akabaho no mukozi wetu wa district eje ya Chiruhura nka agriculture officer kuyarebera byo kufuhirira omwana byayanga yazo presentations naruko musero ya kitengeto mu rukagwa kayanga umugomborera ya Kazo kare
ntanyiro umunadize manyankarwana n'abakajunde banda kunyita nagenda mugenyi wito mukuru n'abandi bagenyi nanye nyegita gandi maraka kubashemerwa kandi ati ndiyo mukamu wenu rigiye tugendane.
Ego amatubo n'ehingwa
Nasigondi kashemerera kore karo karunja baresa bayitahiza nshara akasenje kajinje kashanga maize no nyatsi kakoma yona nacakuza mbwe karema zahenengera rukonoka aho mwende byo byazo MC na rwikize cyabureka zegata muno cyarwe gambe kirindi kashitizo umuntu rugiye abazirwa rwegamarana bampare kayitende ko bw'amataba na cyarsinga runene karagaza serivisi rumshaza abantu hakayizera rutagaba ekuka rw'umutungo kajibongo kana rwagaza rw'etsiza kajizikana rwatsinda kawumbwe kaconca n'amarinda kashonje na nyambere kakangora rabu mwana cyambare tegeka byanengera mushinga kaduye karama zayenengera wanenge aho kwatara kunyore na kisindi karari zibire kugamba kamtika nibani karaganzi sisiri yawe kamrishina wayibondi kananora zatsura mayanza efoto kasonje na chikize kasete kanichere mutubwinje kayera nakabuye kanda ko polisi bahanzira nembu wowe nabuhunge kaconca n'amarinda n'umutera nangurodi kasomoro rigendo ngo konsero n'cyamye beka buryo ne faso binaho cyangwanza nabone kagira bayitatereza kwatara cyekere kukazayenengera kirungi Katerana na shebika na norazatio raprizo na kasaraba na chibuka kashamba barani rugobyo marweni mbona karebere kanda zateza nduriyo mwe fukoma na kaisada na kapeka kasete rwuzura yo mfumesi na wikondi kana norazatio ramayanda ego bana urodebe ego nikafanya
Kanzeni na saso Anosho mizikemena Vivehere mwikame Subure zanga moho Vikweza dinda Nakshubra Bozo mwitame Musubure yamayenze Kayeze bebire Rawe Nyine zirgachanya Kanise naksetva Rusepre kwake mgongo weza Iboni ireza nende Kanuko hangwa mwangore Iboni ireza nende Kanuko hangwa mwangore Ebenu jizengungu Bezanga ukanikama Ayo no Karo karunje kakundwa Weza kurukata Yahinda n'abanyamure Inganda z'abanyakore Weza kurukata Mwesebiro w'umuryakore Abantu karunje niteitwa Weza baboneye Nibashango umuryakore Wabanoye ndabengoma Weza kurukato Urire mweto umuryango amaweze Kagamba n'abaterwa Weza kurukato Kuzo mwami kansine Yanira yatinjika Yanira mwere wesa eboneyire
yanihira yacengeta yanihira muri wesa ebonire yanihira yacengeta yanihira muri wesa ebonire yanihira yacengeta yanihira muri wesa ebonire yanihira yacengeta yanihira muri wesa ebonire.
Kare tuongere umwami rutabe ngaro zamani muganye rutamba aberanyitsire mu njo ininje cultural dancers bengira ngo ubu nkasharenda wongane yeye nawe yangire kugishara utaba tukore iki
iwe wazombugenya ukagumana orya ngo kundi kurya size ntugumanayo
munjirde nyanje n'abantu aba twine aba Centenary Bank bariya kandi they are development partners. Centenary Bank manager Ibanda, you are welcome. Twina aba Ebo Sako Kazo branch manager wa Ebo Sako, you are welcome. Twina director wa mobilization Omwami Robert Rwakandare twajura umugisha gw'amani twamutaye nk'abanyakazo. Omwami Rwakandare, you can stand up for recognition. Abantu aba bakorebe twakwakira. Kazo Secondary School, you are next on stage. Kazo Secondary School kuba rarjeho ndija kura testimony ya hepatitis survivor aijaha no manya hepatitis ne ndware takukira, I mean, but you can live emyaka yona ojine ekikuru no kureba ngo wagumiza muna nembazi kandi ntibamanyisa ngo Kazo Secondary School come ntibamanyisa ngo health centers ziti zona zigwire ahabukuchebezana no kugema hepatitis okurgera izoba n'ubundi bwona kandi naha bari bacebera ora batakebeize n'abandi abateja mbagambire bazamarwa rogeto ga health center 3 batunje obujanshabe. Kazo Secondary School, you are not ready. Kazo Secondary School, we want to finish in time. As in this, we need just remarks, nche, and then we end our function in time. These are students from Kazo Secondary School. Beitu ntibashemerwa abatweyongeraho omukwija mwebare munonga kweiso mukoro gw'ekitinisa. Twine chairman wetu w'eminyeto Chairperson Youth Council Omwami Muguta, you can stand up for recognition. Bakora kuba ashas bakushitamye mu bantu babutosha. Koko Omwami Muguta twakwakira yebare munonga. Omujenyi wetu mukuru no manyaharengo rwa district twineho ba ministers na mwene minister wetu by'amagara bamweta umucyara nankunda Shiba nwa kutwaterera amagara gito mu district tomu mu government yo Mwami Katugunda doctor twine secretary we na namweto webyo kurya konko wa production honorable ham Rebe inuka, you can stand up for recognition. I want to recognize Honorable Says Biarahanga. Warebe ngutombi nari nunje mu district mu manyangu nzire twa Honorable Says. No kansara w'abantu begombora ya nkungu. Kare Kazo Secondary School. Bring a microphone.
Iwerta kumba simkoze kuseturi iwerta kumba iwerta kumba simkoze kuseturi iwerta kumba iwerta kumba iwerta kumba simkoze kuseturi iwerta kumba omwina so mutatonde hepatitis ibambe omukenyefubire owita barungi ababibegoneza obu n'obusasi amawe omwina so mutatonde hepatitis ibambe omukenyefubire owita barungi ababibegoneza obu n'obusasi ogwo mutuma gw'obutatonda katushoberera ogwita barungi ababibegoneza obu n'obusasi amawe omwinazo mutatonda hepatitis ibambe omukenyefubire owita barungi ababibegoneza obu n'obusasi
abo waricikire muri yo obanyumurize gaye
ago witu n'obusasi tuhanure turire
waricikire muri yo obanyumurize gaye
ago witu n'obusasi tuhanure turire
obutabuza n'obuhemura mureke mbabuza barungi obutabuza n'obuhemura mureke mbabuza barungi nashanga ndire ndora yekine njire ntabine mawe nashanga ndire ndora yekine njire ntabine mawe kandi amawe n'amaga barugururutsa buri hamwe n'obumanzi hamera hawawe namara
tukwatanisize hamwe hamwe n'abazibe beitu ejo ndwara yekine tugirwanize tugibinjeho namwambura muri yo owanyumurize gahi
ago witu n'obusasi tuhanure turire kare mwimuke mwe n'abanyayuganda tuze kurwanisa hepatitis yahwaho
nama katujichuni tuze kurwanisa hepatitis.
Siyawaona bakuru b'amadini okubyama mukuretse mwimuke turwanise ogwo muzigu. Katujichuni tuze kurwanisa hepatitis. Siyawaona bakuru b'amarwaro okubyama mukuretse mwimuke turwanise ogwo muzigu. Katujichuni tuze kurwanisa hepatitis. Siyawaona bashomesa mwene okubyama mukuretse mwimuke turwanise ogwo muzigu. Jonama katujichuni tuze kurwanisa hepatitis. Siyawaho aiko burwabo tayobu omushaija afatirayo bwomire twabukaranga ukine kwacenje otarire taruka omuzigwa tetori aiko burwabo tayobu omushaija afatirayo bwomire twabukaranga ukine kwacenje otarire taruka omuzigwa tetori tomujirama turwane tomujirama. Awu awu
tuterera abana ba Kazo secondary school mu ngaro. Hariho wambuza ngo aba mbehire aba n'abana beitu baha ande kantu jangu tusubirena na deshongozi ukusuba nori bakwanje. Taza kwachira testimony ya hepatitis survivor njirangu na yemanya madam PS na njana muntu wari mugishogu nkwanjoro muntu ubundi kuteka ngo akwatanise na rahanga akakora amagara ganje ubundi wara Gotv 19 grade B Entebbe Ntsima services zanyu Dr. Muwanga. You can stand up for recognition. Abanyakazo mu ntero mu ngaro. I think I'm arrived maybe because of you and God. Because ikintu cyabire kibi konkarhanga akarabiro mbantu abo ukugarara amagara ganje. You are welcome to Kazo.
Webare mnonga. Dr. Muwanga Michael ni Assistant Commissioner Clinical Services mu Ministry y'Ebyamagara Takiri Entebbe. Emmanuel Rutamaguzi, hepatitis patient. I'm advised it's not survivor kubanga obugwiro obuno turanabo emyaka yokuturo mu nseji. You're welcome.
Hello everyone. Hello everyone. They have told you I'm a hepatitis B patient and everyone is looking gloomy. Can I see some faces smile? Hello everyone. I won't be able to speak Lunyankole like most of the people have been doing, but I will use the local language, English, because it's the mother language here. My name is Rutamaguzi Emmanuel. I'm a person living positively with hepatitis B. I tested positive in 2016. Okay. Someone is volunteering to translate. Thank you. So, as he brings the microphone, Rutamaguzi Emmanuel is a person living positively with hepatitis. I'm the executive director at the Hepatitis Aid Organization. And as I stand here, I also represent other civil society organizations that come together under the Uganda CSO's consortium supporting hepatitis. The two of them. The CSO's consortium that supports hepatitis elimination, And as I was saying earlier, I tested positive in 2016.
Akachebeza yashanga ine hepatitis 2016.
I was going to travel, and one of the things that I had to do was to do a comprehensive test for the different illnesses, and hepatitis B happened to be one of them.
Akabana aza kuzaheru akaine kuchebeza endwara zona kandi endwara ya hepatitis B ikaberiyemo hariyeze zyabereye kuchebeza.
And after about a week of doing the test, the results came back, and hepatitis B was positive. At the moment, I did not really know anything about hepatitis. But what I was sure of is that there was a lot of bad information about hepatitis. If I remember properly, at that moment, that's around the time we lost a honorable member of parliament to hepatitis B. I can't remember the name, but we lost a honorable member of parliament to hepatitis. So you can imagine the terror and the fear that comes with it, having a disease that a honorable member of parliament has died to. It was really terrifying to me.
Kumanya ngwendwara yane basa kuita member wa parliament wakahurura umutima gwayenda kutreka.
The medical doctor that actually gave me the results was also not informed about hepatitis B because it was a lab tech.
Nomushaho owamuheire ebyarijiro mu kuchebeza kwe akabata ine binje byabere namanye bikwatere nendwara egi ahabo kubakari yarengo y'abarabu abakubandizwaho.
And if I remember, when they broke to me the news, they told me the disease is actually like HIV, and I was actually incepted. I was put on Septrin.
Kubahereze kumuha results ze bamugira ngo endwara egi ninga kakoko ka sirimu kandi bamutaha mbazi ogukwetwa Septrin.
And then after a week, the doctor who had tested me called me and said that I've gotten a contact of a doctor who can help you.
Bwanyuma ya sande mwe omushaho abera mukebera kamweta yamugera toije ntungire omushaho owakubasa kuyamba.
But the doctor who was going to help me, everything he was talking about was money, and I was broke at that moment.
Omushaho oba inwe nangwa muyambe kuyamishire ekigambo kyona kikaba kirisente kandi mu bwire obwo enshaho ye naye kabetarije omu bya sente.
And the doctor was also offering me treatment to cure the disease, but the treatment was also very expensive.
Omushaho akamugira ngo naija kumuhereza obujanjabi obukutambira endwara ya hepatitis konko obujanjabi obwo nabwo bukabo lyobwebe yahiguru eyabera takubasa.
And it is through checking social media, checking the internet, that I got to know about my brother called Kenneth Kabagambe.
Arukurabira aha social media nezindi mpurizana noho yamanyire omuntu obakweta Kenneth Kabagambe.
It is absurd that Kenneth is not in the country, but it would have been better if he was here. Maybe he would have told you the situation then.
Chamsa kugira ngo Kenneth tar muhanga hati kunogira ngo yabarankaha yanija kubagambera imbere kuyaberere obunakobo.
To cut the long story short, it is through Kenneth that we managed to link to different people who could help us, and that is why we are here till this day.
Obutenda kubatuzaho tukarabira mu Kenneth niwe yatuheire omuringo gutwa kubasa kutunga abantu abakutiyamba kandi nuho tubasize kubaho tukejana aha kubagambira izoberi.
But because I realized that I didn't have any information about hepatitis, and I could actually do something because I had a background in working in HIV and cancer, I decided to change my efforts towards hepatitis.
Abo kubakareba ngo akateine information erikumara abya hepatitis akatwamo ngureka hindure byabe nakora atandike kwereza amahurire agakwatirine na hepatitis.
And it's based on that background that we have built our efforts in the Hepatitis Aid organization till this day, till we have this event today.
Kurugobwo amanje gona agateire ahafuta enkora yo kurwanisa hepatitis kandi ni kimwe aha cyatya aha izoberi amukoro.
My message to you today is one. You have one liver and one life. And you need to protect both. And if you are to protect both, you have to take action. And if you are to take action, you need to understand that hepatitis cannot wait. So that means that if you have to take action, it should be now. So if you are here and you do not know your hepatitis B status, take action. The Ministry of Health has helped avail free hepatitis B services. I urge you to go and take action right now. Continue to take action. If you get to know your hepatitis B status and it's negative, vaccinate right now. If you took your vaccine some time back and you forgot or probably you missed your date, take action and vaccinate right now. And lastly, if you test positive, there is still hope beyond being positive. I think I look good, right? So
washanga oinaka koko ka hepatitis otandiche nabahamza ngo haramatsko kandi yana abagira ngo kumureba ruyare no mutsigaza murungi yashekamu abishibona nabo bashika. And
as civil society, we continue to commit to work with Ministry of Health and all development partners to support the elimination of hepatitis for God and my country.
Bonke bitongore ebyabantu buntu nibagira ngo bejagumanwa bakorana na ministry ya ibyamagara okurwanisa hepatitis abwaranga ni hangariye na nyeneri yanje.
Webare mnonga Honorable Daniel Chimosho hamwe na Emmanuel watwa testimony kandi ninyenda kubebaza mnonga Honorable Dan emirimo yiwatandikireho nayo cyagikoraje eyo kubera umugambirizi. Ninyenda kweta, I would like to welcome Professor Potiano Ochama ogunasingayo obukugu achirwire eki orama washomoka shoma mnonga noba professor. So erizoba twija na professor habwire obugwire bunuya bwa hepatitis ninza kushuba nkushabeho na Rebodan oije ovunure obotapute kubanga nyoru kiga rwanje nibasa kushobye bintu webare.
Thank you very much. Dan is my boss. So our guest of honor, allow me to respect the least of persons that are invited here. I was asked to speak about hepatitis.
Banshaba kugamba ahandwara ya hepatitis.
My work was made very easy by these students.
Omurimo gwanje abana b'abantu beshongora bagunyorobeza.
In fact, they said everything that I would say, and at this point I could even stop.
Bagamba byonde binantebekanise kugamba nambwenu nobunakwenda nindekeraho.
St. Catherine Girls' School told us how hepatitis B is spread.
Aba St. Catherine Girls' School batugambira endwara ejo kwera kukwata.
And they told us that they now know all the tricks that hepatitis B plays in the body, in people.
Kandi batworeka ngo nibamanya n'obukodyo bwona obw'endwara egi eri kukora mu mubiri gw'omuntu.
Because we are commemorating World Hepatitis Day, I am going to say there are 5 different types of viral hepatitis.
Nitukuza ekireke kya hepatitis B nahabwekyo ninza kugamba aha bukoko bw'emiringo etano 5 etano eya hepatitis B.
There is hepatitis A, B, C, D, and E.
Obukoko obwo babugamba mu ngambisa hati mbwetera omuri nyankore basa chada mwayongereyo.
Hepatitis A and E do not cause significant chronic effects on the liver.
Hepatitis A na E tikusasa munonga ekine.
And they spread through eating or drinking contaminated food or drinks.
Nikwata zikurabira omukurya naro kunywa ebyokurya ebikubabirumu omwe oburofa.
They cause liver disease, but the disease does not stay for long in the body.
Nizirwaze kine kwonka ekine ekyo endwara teguma mu mubiri kumara obwire burengwa.
B, C, and D cause bad liver diseases.
B, C, and D niziretere kine kyarwara munonga.
Hepatitis D does not stay on its own. It requires hepatitis B in order for it to survive.
Hepatitis D tekaguma hoyonka neyetenga hepatitis B kugira ngo zombi zikore hamwe rero zikurejeje.
So you don't look for hepatitis D where there is no hepatitis B.
So waba otaka kwatsire mu mubiri gw'omuntu hepatitis B otakaronda mu hepatitis D.
Now hepatitis B is the most common virus that we have here.
Hepatitis B niyo kukira yo kugambwa no kubeyo burabe omuyihanga.
And they spread, it spreads in the way that the St. Catherine Girls students told us, mother to child.
Kwata omuringo ogw'abaana batugambira aha kurugaha muzeire kuza mwana.
And by sharing sharp sharing sharp objects.
Nari mwabaga n'ebintu ebikucumita nk'empitirizo obusyo n'ebindi.
Via blood transfusion.
Nari omushagama bakutamu eshagama.
And sexually.
Nari ombushambani.
Now, blood is actually screened before it is given to anybody in this country.
Eshagama nebanza yacheberwa bataine ubagiteiremu omwihangomu.
And so, majorly, we are having the other 3 mechanisms of transmission. mother to child, sharing shaps, and sexually.
Nabwecho nekira kurabira mu miringo eshatu kuruga omumama kuza omwana okukozesa obugirita n'empitirizo nizo zimwe nari okurabira omu bushambani emiringo eshatu.
In this country, 4 out of 10 persons have hepatitis B.
Omuihangomo abantu banaha abantu 10 beine hepatitis B. Hati mwebaraho murebe.
So when you see 10 persons, you are likely to have 4 with hepatitis B.
Wareba muri abantu 10 mu mwanya gumwe nikibasika kushanga ngo banaha rimwe beine ndwara ya hepatitis B.
Most hepatitis B in this country is found in the northern part of the country.
Itweko muyangomo erikukiza yo hepatitis B no mu matemba ga Uganda.
This area where we are is supposed to have the lowest burden of hepatitis B in the country.
Aha turi no washemerere kuba ntakizayo kugira abarwere bake munonga aba hepatitis B.
But even that low burden, most of it is found in this region where we are in right now.
Kwonka no barabe bake munonga abenji nibashangwa omuchitwekeki ekiturumu izobere.
So we need to take care.
Nabwecho twine kufayo munonga.
The girls of St. Catherine Girls told us, know your status.
Abana ba St. Catherine batugira ngo twemanye okutwemereire omundu araye hepatitis B.
The reason is you don't want to live with hepatitis B without knowing that you have it.
Eshonga bwenjo shemerere kwemanya tichirungi kuturaho n'endwara egi otari kuchimanya ngo ogine.
1 out of 3 persons with hepatitis B will die with hepatitis B if nothing is done about it.
Omuntu omwe abantu bashatu, come again on that.
1 out of 3 of the people who have hepatitis B, who are living with hepatitis B, will die with complications.
Omuntu omwe abantu bashatu naza kufa aitwa hepatitis haba hataine kikozirweho ahamagaraje.
So you need to know if you are infected or if you are not infected.
Nabwecho nikikuru kumanya waba ine ndwara egi naro tagine.
If you are infected, you need to take actions immediately.
Waba ine ndwara egi no yetenga kugira eki wakora aho naho.
The doctors are trained to identify those who are infected and those amongst those who require treatment and they are treated.
Abashaho nibatendekwa kuchebera bakamanya abo abaine ndwara egi kandi omuri abo abaine ndwara egyo kumanya barikwetenga obujanjabi.
There are some who may not necessarily require treatment immediately.
Abo kuba hariho abakuba bagine konka batakwetenga bujanjabi aho naho.
But they should be monitored because at a certain time they may require treatment.
Konka baine kugumwaho erisho ahabwo kuba ntabasa kubaho kwetenga ngo nabo baragurwe.
In terms of the treatment, many people ask questions, is there treatment for hepatitis B? The answer is yes.
Abantu bengi nibabuuza ngo hariho ekikubasa kujanjaba endwara ya hepatitis B nekyo kugarukwamu nikigira ngwego obujanjabi buroho.
Is there a cure for hepatitis B? To date, no. The answer is no.
Ekibuzo kindi nikigira ngo hariho mubazi oguru kutamba endwara egi ekakyerera kimwe ngo nakyo kyo kugarukwamu nikigira ngo ngaha obwahati omubazi ogwo tukabireho.
This is not only for hepatitis B. You know we have HIV which has treatment, but again it has no cure.
Kandi endwara etari kutambirwa hepatitis B yonka hariho na sirimu nayo neragurwa konka teri kutambirwa.
And if treatment is required for hepatitis B, it is taken lifelong.
kandi habaho okuragururwa kwa hepatitis B omuntu najanjabwa kandi aturaho kumara ubwire burengwa.
Don't start on treatment. If the doctor decides to put you on treatment, you should know that that treatment you are going to take it forever.
Omushaho kwaratandike kujanjaba handwareji omanye unaza kujanjaba mpaka amagara gaogona.
And many people have lived with hepatitis B while on treatment for a long time.
Abantu benji nibatura n'endwareji kumara obwire burengwa munonga.
Okay. So I have seen a number of people who are started on hepatitis B treatment and they take the medicine for 1 or 2 months. They leave the medicine, and I've seen a number coming back years later with big liver cancers.
Ndebera abantu benji abakutandika obujanjabi bwa hepatitis bakiba bahise hagati bakarga hamebazi kandi bakiza kugaruka mu marwariro okashanga bagizire kansa y'ekine nare kokoro y'ekine.
I want to say I see very many people with hepatitis B from this place.
Nindeba nari ninjanja abantu benji abaendwara hepatitis B abakurugo mu mwanya ogwo.
Most of them
benji hari abo
stop the treatment and go to take herbs.
benji hari abo nibargaha mibaze yinkuba mbaheire batandika mibaze y'ekinyankore nareje y'ekiraguje eyaburijo.
And those herbs will not help.
Kandi embaze y'ekiraguju ninyenda kubahamiza ngute kuyamba.
If you decide to take it, at least take the other medicine as well.
Kare korabe watwire mu kunywa embazi yawe y'ekiraguju gumizamu aha mibazi ey'omushaho ow'ekijungu arikuba kwire.
So this is very important for us to understand.
Ekyo ni kikuru munonga aha bwaitu kucetegereza.
Because liver cancer is a very deadly cancer.
Aha bwokuba ekokoro y'ekine n'ekokoro mbe munonga.
The studies we have done show that from the time you are diagnosed with the liver cancer, you can only live for 2 months.
Okutondoza okukozirwe nukworeka ngu bamanya ngo inendu ekokoro y'ekine obwire burengo bw'okubasa kuturaho n'endwara egyo n'amezi 2.
And it should not really happen, at least if somebody has known that he or she is infected.
Kandi egyo tucemereire kubaho no kukira munonga omuntu yaba yamanyire ngo ine endwara egyo ya hepatitis B.
So I want to thank you all for giving me this chance to give this information to people.
Ninyenda kubebaza munonga abo kumpa omugisha gwo kuhereza abantu aba amahurraga.
And I think I won't take much time. That is where I will stop.
Inguza kurenga aho mbe nagamba noho nakoma. Nkaba science okuwamanya tebagamba bingi. Nakora umurimo murungi haro PS na under secretary so tarumbya invoice kuchebera verification nibashashura direct. Webare munonga.
Ando cyakora. Webare munonga nitwenda kwebaza aba Kazo FM na Sky TV by the wogu mukoro guli live aha Sky TV mwebale munonga okulebeka mwatwagira nka ministry y'ebyamagara ko MC take over.
Munchirize ahabwe shaha tete chairman wa district ya Kazo Dr. Reverend Mugisha Samueli Katugunda jogambera n'abantu bawo.
Everybody, Master of Ceremonies, our guest of honor, Permanent Secretary, Minister of Health, team from the Ministry of Health, headed by Under Secretary, our members of Parliament, RDC, district leaders, and sub-county leaders and other leaders who are here from this district, leaders from other districts, district speaker, chief administrative officers, and the technical people who are here, honorable councillors, members of the executive, security officers, religious leaders, invited guests. Amazina ganje n'abanyita Reverend Mugisha Samuel Katugunda. Omugenyi waitu mukuru hatubampereze lya Dr. koko wawahurire. Tinshomerebwa obushaho konka nyetegereze by'obutegeki okuma mbimazire mu mwanya murayingwa. Mbene abanyakazi bagize ngo ekiri kubasa no kwereza ekitinisa cye bwa Dr. Mbere munsimire haba kibere kitorobi. Our chief guest nani yenda kubanza kukoreka abanyakazo tibesire bayisha. We invited these people to come to attend this function. Kani mbareba nbengi abantu bari yoko medical camp. Nani mbashaba abanyakazo tubanze tubasime kubeta mukayija kuja mukatwaso gumukoro. Tubatera umungaro mwe bare kuyija. Mwena himuri tubasima kandi tubatamwe kitinza. Ekindi kinani mbashaba abanyakazo oguno mugisha gumutano. Kutunga ogumugisha gwo kutebekanisa umukoro ogu gwihanga yona Kazo yonani jangu mureke tsime permanent secretary Dr. Diana okutwikiriza omuza district zone zihangeri kugira ngo hosting this function. Nani mbasha umutera umungaro. Ekindi nani yenda ngutsime President Museveni. Manya President akatukwatsa obwa COVID na Ministry ya Health. Obwa COVID Kazo tutraferwa abantu bengi. Tukaferwa abantu cyamazima tukaferwa abantu. Konka turakire nk'ezindi za district kuzabayireho. Bwena nimbasha bangu sime president sime president la ministry ya Health kutwatiraho obwa COVID kureba COVID teratwitsire nkahandi yo kuhabaire abantu baitu abamwe bakafa konka bayingi bakarwara bakira. Tubasime tubatera umungaro. Nani nyenda ngutsime abantu abatekatekira omukorogo. District officials, Ministry of Health, abatukwatize and also our partners kureba ngo tutekatekira omukorogo twagufisira izoba hatuguriyo no kugenda mu maisho. Kati basime twena tubaterera umungaro. Kandi nyenda kusima ba members baitu ba parliament. Okutukwatsa buri kintu cyone kitukuba twino mu district omu. Batukwatsa. Batamwibega lya mani. Aho twetu twashikira kwenda kuremwa. Konka kubayija batamu mukono na bandi twatuyinaha no kugenda nebyone twakora kutanduka mukasheshe. Mbwere mbansimire mbatera umungaro. I want to welcome our guests from the Ministry of Health. I want to thank you for coming. I want to thank you for the support you have given us and all those that we have been with in preparing for this function. Let us clap for them. Now, I'm not going to repeat what I have in this speech. I'm just going to be very brief. I want to give you the status of Kazo district. Kazo district hepatitis status. In the year 2020, they tested 5,283. 195, those were positives. And this was 4%. In the year 2021, they tested 2,522. 41, they were positives. This was 2%. In the year 2022, they tested 3,372. 162, they were positives. And this was 5%. Then this year, 2023, they tested 1,775. 19, they were positive. This was 1%. So now, this is the status now. Omjenyi wetu mkuru chinkwenda kukoleka, these are only those who were tested. But we have very many people who stay there who are not tested. Kandi abengi bafiira okumchama bariyo nibafa. So okuletaho ogumukoro ruyare ekintu kihango ekyokutugasira nka Kazo district. Abako tuyina abantu bengi abafiire okiza kuhurira ngu baisirwe kine endwara yekine omuringo nk'ogwo. So endwara yekine nari kansa yekine omu muri Kazo district erumu. This disease is here in this district. We have it. So to come here for this function really nkiba kishikire kandi tuyina amatsiko kija kusiga kyatambira district yaitu. Our guest of honor, this is a young district. Kazo district, as you have heard, started in 2019. We are just moving slowly. We have a population of 23,000. Population itwine n'emitwaro abiri n'eshatu n'enkumi ibiri. This is our population. As you have been told, we have 19 government health facilities. We have Kazo Health Center 4 as the top. The services given at Kazo Health Center 4, our DHO here mentioned some of these services. We have outpatients, inpatients, laboratory services, immunization services, delivery, operations and cesarean sections, family planning services, cervical cancer screening and treatment, art services, blood transfusion, dental and eye services, and others
They are there. This is our district hospital. This is where all our people are referred to from other health centers. Okurugum Magombora, Okurugum Health Center 2s, Okurugum Health Center 3s. They all come here. And not only our people from Kazo, even from Chejegwa. Chejegwa no river heina Kazo. Pateji ya Karwenyi. Even from Kamwenge, even from Ibanda, even from Sembabure, they come here at Kazo Health Center for dental and eye services. We have health workers in charge of this sector. Kuonkati bagira byokukozesa. Dental, buli omwana yefu kuba kugenda bashango inirino ekizibu ky'amaino oza kwerondera ebyokukora ebyokukozesa. The person is there. N'amaiso nukwokwo noza kwefaho noza kwerondera ebyokukozesa. Then we have health center 3s. Every sub-county has a health center 3. Shananka Mijina, ejo babajo gambiri. Nakazu sub-county. Then we have health center 2s. They are there. Our guest of honor, we have projects. I'm just trying to be brief. We have projects implemented in the health sector since 2019. Eyokubanza, upgrade of Nshunga Health Center 2 to Health Center 3. Number 2, construction of maternity, general ward, 3 staff houses, each in 2-in-1, OPD, and a laboratory at Canon Health Center 3. All those they have complete. Construction of Health Center 3 at Engari. This project, this Health Center 3 is already complete. Kandi kino manye kiwatukolere kiwatiyambire ahirwa Rulyengari. Bikabi turiyo mu Maraka. Upgrade of Champangara Health Center 2 to Health Center 3. That one, the work is still ongoing. Construction of maternity ward at Kazo Health Center 4. Waboriyo warebe birukukorwa. Renovation of Kaichumu OPD okahikayo na issues ezabe ziriyo zikaba solved. Renovation of Mbogo Health Center 2 OPD. This work has been completed. Construction of staff house at Orwiji and Kishuma Health Center 2s. Completion of maternity extension at Kazo Health Center 4. It is also awaits commissioning. Ezo nizo projects tukozere omu Kazo district. Kandi zote iremu mukono our chief guest projects enyingi ozitairemu mukono. Kandi ezifwire nitukushaba ngo zigure ezitaka hweri nizako. Na nimbashaba abanyakazo mutere chief guest abukona watera mukono on project hezi zone zikozurwe. Planned projects in the health sector. Upgrading of Rwamuranga Health Center 2 to Health Center 3. Chief guest na nimshaba ngo eki nakyo. Egiye Rwamuranga ejo. Okitera mu mukono na nimshaba ngo tumusime tumutere mu ngaro Rwamuranga. Completion of DHO's office. Renovation of OPD at Ngomba Health Center 2. Okurenovatinga Ngomba. Omwami Abel nakureba arinka ya Abel. Ngomba irwaro yaondeza kukorwa. Mijina Health Center 2. Tena reba habwomyezi. Mijina Health. Ebyola nibirgo woria murike kundeba rene nibirgo woria. Dugusio Health Center 2. Kayanga Health Center 2. Renovation. Then construction of staff house at Mijina Health Center 2. ababinyina nkanta abahurire humba bagambira ngwimwe district kabanaga tumine project abamigena nkana abihurireho hati we have also our partners abtukukora nabo mu district omu nani ngenda ngumba kuonjurire mbarebe abakubasa kuba baroho Mayanja Memorial Hospital Foundation. Arhoba Mayanja? These are our partners, chief guest. Our Mayanja, bigger ya mdije hawa Mayanja. You said Tasso, about Tasso. Mayanja come here, Tasso come here. About Tasso, bare? Accord. Eh, abantu shitubayije abambe. UPMB, UHAA, Marstops, Uganda. This is Tasso, this is Mayanja. Kare, abandi tubaba sakwija. Konka they have been supporting us. Mbatero mungarabanya kazaba matezi mukwe. Kare mugakeye. Chief guest Njoni Impendera, I'm going to present challenges in the health department. Though there is improvement in health service delivery in the district, there are a number of factors that affect effective service delivery as indicated below. Eyokubanza, lack of an independent district medicine store and a district vaccine store. We don't have a medicine store. Chief guest ninjira nkora watungira umwanya ninjira kora orabaha district tukoreke ahituru kubika embazi yaitu. We have one hall, a council hall, a medical store. That's where we keep medicines. That's where we keep motorcycles for the staff and other things. Lack of dental equipment at Kazo Health Center 4. Dental equipment na nabugambire. Lack of OPD emergency unit at Kazo Health Center 4. OPD. And you pass there and you see where our people most health facilities need to be renovated, especially health center tools. Ezin nangwa zibere renovated. Konka kirwe staka bere esikirkubi kandi staka tungire buri boku ziri renovating. Inadequate accommodation of staffs. Some facilities have no means of transport to conduct integrated outreaches. Some facilities, even Kazo here at the health center 4, we don't have transport. Some health facilities lack safe water source. Some health facilities are not connected to electricity. Inadequate space for facility upgrades, especially health center tools. Lack of medical equipment for some of the newly constructed health facilities. Lack of an ambulance. Chief guest ngenda kusima tukatunga ho ambulance eyati yambira mu COVID. Konka tebasize embera yakunuya yenguto yensi. It is a small vehicle, small ambulance. Tetbasis. Tukabiri tukushabango. This is a big facility. Tukabiri tukushabango otungire ambulance. Challenge ndijo yinkureba ibatata hoje. Twine district medical officer. Yes, it is our duty to look for district medical officer. But we have been advertising and we have been failing to attract. We have advertised, I think, 3 times. failing to attract. We just only have one doctor at Health Center 4. Hato ogunwe twemereireho in the whole district. So twantukushaba kwa kubasa mu ministry kwa kuteraho buriyo telemirwe mbwene hati tukore iki twine cyo gukora hati niyo amashu tugatera hariwe Chief guest ni mpendana na request ekyokubanza egiye challenge kuriya no shot kuriya tunagitaye twine challenge ya stock outs embazi kuburo mu marwaro embazi amarwaro gaitu na Health Center 4 Health Center 3 Health Center nibatunga embazi ehwaho omkwezi kumwe oshanga amarwaro gona gari yaho gemereire gatari mukabazi kona. So we have this very big challenge. And not only that, abakaza bakuzara aha Kazo Health Center 4. Obundi nundi mingi nuba kurete mbazi. Babura kureta mu nebyo mu maternity. They don't bring surprise for the maternity. So you find that every woman who delivers here must provide for herself. Akasio amanya akagira ki gloves ni hano kandi abantu bakuno yabamwe naboro kushanga burkantu kono mukazi ija kuzara retaka nangu ubundi cyenda kuterana n'abakozi baitu birwaro cyenda kuterana nabo konko ubundi tubantumanya ngo ebindi tubabine stock out. Ekindi, this is a request, Madam PS. We request for the upper grade of Kazo Health Center 4 to the level of a district hospital. Kazo Health Center 4 has a big catchment area. It serves Jegwa, Sembabure, parts of Kamwenge. Considering the population in Kazo district, which stands at 232,000 people, as projected from the Uganda Bureau of Statistics, there is a need for the district hospital. Tinyino kunkubasa kucyongereraho Kazo no gimanya PS. Mbene nze kukishobora Kazo no gimanya ugizarirwemo no manye kizubu okurga burungo karga okaza burembo okaza nkahi twena district ya Kiruhura district, as we have neighboring districts. Kiruhura district has a community hospital. Ibanda has a community hospital, Kagongo hospital. Now Kazo, it is just there. Our people go to they just get stranded in all these areas. Muter is a district. I mean district hospital. Madam PS, we request for the appropriate ambulance for the district. Madam PS, the district requests for an independent district medical store and district vaccine store. Madam PS, currently the district council serves as a medical store at the same time as a multi-purpose hall, which is not conducive for the medicines. Kwa kushikahoka no okashikaho district okarebo kutukubika embassy yetu. Then, Madam PS, on your last visit to Kazo, you pledged to provide a scan to help our pregnant mothers. Those mothers who are delivering, they have a big challenge. Scan. we refer these pregnant mothers to go to Ibanda for scanning. Think manya nkachugambiraho kandi nacyo ningira ngo ninyongera kukikwishya. Madam PS, we request for Uganda for upgrade of Burunga Health Center 3 to Health Center 4. Madam PS, we have one constituency. And I think the policy is that Health Center 4 goes to a constituency. But unfortunately, we have one constituency. Think manyaba member ba parliament, Honorable Dana, Honorable Jennifer, oban teka hoki, obakutunga ndijo constituency, obantu ku matricity. Ekyo stika kimanyire. Konka twaba sitaka kitungire. Teka omuntu wa Burunga Hansi Kabogore. Okaza Kataraza. Okaza kuriya nanka kiguma. Rero ngubona bariyeja kuza Kazo Health Center 4 kuza kurunga yo referral services ezibata kutunga Health Center 3. Bena ninkushaba otereze mikono okwo mu kutensa kwanyu Health Center 3 ya Burunga ebe Health Center 4 esavinge kitweke ekyo kyokwo rero tukaba tutegerezeho district hospital. PS, a pickup for Health Center 4 to ease support supervision and other related services. It is also necessary. Madam PS, the community of Ntamba's parish is among the parishes with the highest population. Ntamba's parish area henyo kuri enyuma omunsharo na Kyengando. It takes people from Tambaz, it is 10 kilometers to the nearest health facility to Kazo, Health Center 4. Due to the need to have health services nearer, the community mobilized and bought land equivalent to 4 acres for health center construction, and therefore request for Health Center 3 at Ntamba's parish. Abantambazi barwaha baitu barinka yabantambazi. The speaker ngukwarya baguzire n'umwanya gwabo bagura gwo kutamwirwaro. Ntambazi Health Center ejo Ntambazi eyumuruka gwa Kazo sub county. Kazo sub county tayine Health Center 3. Kazo sub county. Hata abona barwo kubona bija bazaha. So mwe nacyo kucyakubaho buryo bwona nabo tubahereza ntanga yaba abatunzi isoburyo kubahereza irwaro. Ninyenda kongera kusima abo kutereza izoba eri naganda garakurateho kubana yitwe okashitamana yitwe okareba ibyondo byo noza kuza Kyengando noza kuza mu marwaro gaitu noza kutereba. Ninyenda kugambira ngo kwarho district eino kuhereza burungi mu marwaro neito turumum district ya Kazo. At least we have done our best to improve health services in Kazo district. Nanyenda kwanjurira bebembeza bariyaha aba Kazo district abaija mukoroku. Aza nyenda ngumwemerere mwene orukumanya nguwe no mwebembezi at any level from LC1 to LC5. You stand up for recognition. From LC aba LC1s abariya kare murije, you step forward. You step forward. You come here. Okumanya ngo no mwebembezi. Again, team ya leadership ya Kazo district. Nyenda members of the executive first. Speaker banzo yimerra. ogu niwe speaker waitu kandi atukoreire omurimo omurungi nahurira na deputy twine na deputy ogu kandi batukoreire kanso nungi kora hariho kanso itwine omu Uganda na kanso ya Kazo district. Members of the executive mwemerera, members of the executive nanye mbaini omurubone nye mchenyenga. This is the secretary for production. This one is secretary for works. This one is the secretary for social services. And she's the one who has been connecting us with your office. Mbateru mungora bona. District councillors, abaro. District councillors. Okay, this is the youth councillor. This is Honorable Verna representing Remkoma. Honorable Issa representing Kazo Town Council. Sub-county chiefs. No. Chairman LC series. Chairman LC series. Imumuiza kwe yanzura.
Ana maintabana mzidani chairman LC series ku sub-county.
Jackson Muhebwa, chairman LC series for Kazo sub-county.
Yowena nayanjire Justice Mugarra Muhimbura, Mayor Kazo Town Council and chairperson or chairpersons the whole district.
Nyon Banyeta Gumzam Amos, chairperson LC series Engar sub-county owa hera marwara abiri.
Kanoni Johnson Kakuru, chairman wa kanoni ahirwa ruhire ntwenda health center for
Nyowe Ndubwomezi Franka chairman wegombora ya Migina otakatungire health center 3.
Ndikachonchorozi chairperson wa Champangara LC3 owirwa Relsia eryo wathereze yebare mnonga.
Ray Kanoni habere mfite umukiza kivengeri deputy mayor Burembo Town Council.
Town Council, Kazo sub-county. Kare, esha. Hata mwemerera barebe just. Aban sub-county councillors. LC tuzi murijeyo. Mutagenda. LC tuzi mza. LC tuzi. We have one LC2, one tambaza. Nwar kushabye no. Nwar kwendi rwa rogoreba PS. LC1s. LC1s mushikyaho mu mesho. Women. Kare LC1s. Aba nizonya myozeiti za LC1s zezriya. Mutagenda. Kare women leaders. Youth leaders. Chairman wa youth. Murije ya baba rebe. NRM deck ya NRM. Abandi youth leaders ni NRM deck. Kare nani mbasha mutakagenzeri. Nani nyenda kutubanze members baitu ba parliament. Nani mbasha ngumwisha omtimu weki. Abukwa twenu we are leaders of Kazo district. RDC. RDC, deputy RDC, tarho. Diso kaya barohoshi. Diso kaya baroho ya agenda. DPC. Dafuka DPC. So Madam PS na nyenda kuporeka. Ntwenda ariyo technical people nyenda kubeta. Na nyenda kureba this is the team, the leadership team. Kandi tukoranka team obiya hatarumuru kurwana. Whether manya the chairman is fighting this one or manya fighting here, no, we don't fight. We work as a team. That's why we have been successful. Kare mugarike, thank you very much. Kare, Cow. Yes, Cow and your team, quickly.
tendere. The technical people, herese workers, the technical people from the district, technical people from the sub-counties. Quickly, you people, teachers, abashomesa, abamurka, abamagomborra, abashaho bente, abakona bona. Kawan deputy, cow, you in front. Kawan deputy. Kare, this is the team, the technical team. We have a very big team, the technical team. Kanda abo batwatize mirimo, haramu herese team, haramu bona bakurwo kwa bakuru mitongere bitari bimwe na bimwe, and really they are doing us a good work as Kazo district. Kare mwebore munonga mukama bahereza umugisha. Ebi nabigamba bwarhanga nensi yanje mwebore munonga.
Muterere chairman wetu mungaro zamani. Manya chairman wa kuba ine byo kugamba bingi au ka district age na jimanya kana jetorora buri mwanya. So abandi nibeja kuchwekanisa. Allow me to invite the RDC, Captain Kakoza.
Yeah, thank you very much, the MC of the day, our chief guest, and your entourage, all officials from the Ministry of Health, district staffs, and all of you members protocol observed in the interest of time. I welcome you to Kazo district and thank you for attending this wonderful function. Allow me to thank the government of Uganda for it has done all that is required for this district. Madam, I've been moving around and we've been moving as a team. All that is required for an adequate health service in the district is almost there. We are very grateful to the upgraded LC2s to LC3s, houses for health workers, and best of all, the enhanced salaries. So members, what else do we require? We must serve our people. Madam PS, we thank you very much for having considered Kazo district for this wonderful occasion. We are now on the world map. We are being watched everywhere. And moreover, for good things. Even if it was for Gatali Konfufu, here would be viewed for wonderful activities. So thank you very much for considering Kazo district to host this function. And please come over again and again. Here in Kazo, we cooperate, like you've seen from the LC5, all of us, technical people, political, Sujiwat, we work as a team. Because all that people want from us is services. We must cooperate to offer services to our people. So we are going to continue with this spirit and expect the best from us. Our dear honorable MPs, thank you very much for lobbying for the district. Wherever we are proud of you. Please continue again and again for the betterment of our district. Down here to our local people, hepatitis B is a disease of the liver, like you've heard, HNA. You cannot see your own HNA, you cannot see your own liver, like you can see that the leg is swollen or the arm. So these are delicate internal organs that we must protect. How can you tell that I have hepatitis B? It is only by testing. Our chief guest, as we were moving around, some gentleman came to me, and he had red eyes, not yellow eyes. And these red eyes were typical of Waraji. This man was Umsinzi. He asked me that, do I have hepatitis B? But from simple observation, Kabaharaji, not, and I'm not even a health worker to determine whether your eyes are yellow or not. So please visit the health workers, technical people, and you get tested. You'll be tested, you'll be healed, or government will do everything to make sure that things are okay. As I wind up, I thank the organizers. All of you, the IPs, everybody. Things have been so good. We appreciate. God bless you. I think for the last, 2 months, it has been hot every day, shining very seriously here. And it is only today that we are having wonderful weather. This is a sign that, Madam PS, you are blessed. Thank you very much. It is surprising. Really, the weather today is the best. Lastly, but not least, the media, thank you for positive coverage. We appreciate. Thank you very much. God bless you. And as you go back, Johnny Masses, thank you very much.
Ewale mnongara DC, tulionza kweta development partners. Niveja, I don't know who's representing them. Omugyenyi wetu omukuru, I want to introduce to you by in charge of Health Center 1, the VHTs. Kanshabe VHTs mwena imuri abana bashaho betu bebyaro mwemerere muhubere omugyenyi wetu mukuru amagara gaitu nigatandikiraho kandi omugyenyi wetu mukuru nakushaba mbatereho enteekateeka abantu abo nibatuyamba.
Webale munonga. I wish to take this opportunity to invite Dr. Kagwa Mugaga of the World Health Organization to represent the development partners, after which we shall have remarks from the Director General Health Services, represented by Dr. Richard Kabanda. Thank you.
Thank you very much, my dear Emmanuel. Emmanuel is the name of my late father, so I connect well with Emmanuels. Today, as introduced, dear PS, the chief guest, I'm Kagwa Mugaga. I work with the WHO in the country office as the focal person for HIV, hepatitis, and sexually transmitted infections. I come here today, dear chief guest, to represent the country representative who is not here. I will read his speech and then I leave it there. This is the speech for the WHO country representative, Dr. Jonas Tegen, on the occasion of Uganda's commemoration of World Hepatitis Day. Kazo District, today 28th. The chief guest, our permanent secretary, the members of parliament present, the district leadership, delegates in your various capacities, ladies and gentlemen, our guest of honor, I bring you greetings from World Health Organization, the Director General and the Regional Director for Africa, and also the UN family in Uganda. It gives me pleasure to be part of this occasion where we commemorate World Hepatitis Day. The World Hepatitis Day is a global campaign that aims to raise awareness and action towards the prevention and control of viral hepatitis, an infection that causes severe liver disease and eventually liver cancer. As already highlighted by our senior professor, there are many forms of viral hepatitis, but important to know is that we have 8,000 new hepatitis infections every day globally, which are mostly going undetected. Chief Guest, this is unacceptable, since we know that this infection is preventable by vaccination, and we know that we have antiviral medicines for successful treatment of hepatitis C at least. The World Health Organization attaches great importance to the fight against all forms of viral hepatitis the world over. It is important to note that viral hepatitis causes breakdown of the liver's normal structure, as highlighted by my colleague Emmanuel again. And this prevents the liver from working correctly. The theme for this year's World Hepatitis Day, One Life, One Liver, seeks to emphasize the fact that links between viral hepatitis infection and liver injury, the damage it causes to the liver, and the broader issues of liver health that relate to primary health care. Chief Guest, as WHO, we take stock of regional statistics, and we know that in Africa, there are 91 million Africans living with hepatitis, and that in 2019, we had an estimated 1.2 million new hepatitis infections and 125,000 hepatitis-related deaths. And these were occurring mainly among young people, the productive segment of our population. I know that Uganda has a predominantly young population, and that we need to quickly take action to reverse and prevent these catastrophic deaths if we are to sustain Uganda's economic growth. Distinguished delegates, at global level, the member states of World Health Organization in the year 2022 unanimously endorsed WHO's global hepatitis strategy. And subsequently, they endorsed the framework for integrated multi-sectoral response to HIV, TB, sexually transmitted infections, and hepatitis in the African region. This framework targets to reduce the new infections by 90% and deaths due to viral hepatitis by 65% by the year 2030. WHO supports regional and national efforts to eliminate viral hepatitis by 2030 through providing clear guidance for decentralized and simplified person-centered prevention, testing, treatment of viral hepatitis, including eliminating hepatitis B through birth dose vaccination. Despite the availability of diagnostic tools and effective treatment, a lot still needs to be done to reduce hepatitis-related deaths and infections. We know that more than 90% of people living with hepatitis in Africa do not receive the care they need, and less than 10% of that population has access to testing and treatment. This leads to progressive and advanced liver disease, devastating financial burden, emotional distress, and at most times stigma. Testing, treatment stand as a public health approach and will remain with gaps in this respect. Let us therefore take advantage of the available tools and deliver health for all persons. We must make services available through strong primary health care approaches that are increasingly funded through domestic resources. Ladies and gentlemen, we all, as already heard, have got only one liver and one life. We need to protect them. At country level, the focus of WHO is to support the health sector and ensure that quality technical assistance is given to the government and partners for translation of global strategies and guidelines into simple tools to combat viral hepatitis in Uganda. In this regard, I call upon the Ministry of Health to finalize and launch the National Viral Hepatitis Strategy. Madam PS, this is a gap. We need to be guided by a clear strategy. This will help us to implement, monitor, and eventually evaluate our efforts in a systematic way. Permit me, dear Chief Guest, to register our appreciation to the government of Uganda for consistently funding community interventions against hepatitis B over the last several years. I also applaud the government of Uganda for being among the 16 countries in Africa that provide hepatitis B birth dose vaccination to all our newborns that qualify for it. It is now our desire to move the focus onto active testing, linkage to care, and follow-up of every person diagnosed with viral hepatitis to protect the health of the liver. Dear partners, as I conclude, dear partners in the fight against viral hepatitis, a hepatitis-free future is achievable with united effort. I call upon all partners and stakeholders, including the civil society, to continue to work together towards the elimination of viral hepatitis as a public health threat by 2030. I take this opportunity to reaffirm that WHO has been and will continue to be a major partner in the country's response against viral hepatitis. I thank you and wish you a very successful commemoration. Thank you.
A round of applause to Dr. Mugaga. We are live on Sky TV, and Sky TV, thank you very much for this coverage, and all the other media houses present. Mwebale mnonga aba Sky TV okulebeka ngo mukoro gwa aba live abantu ebaliyo baguleba. I would like to invite the representative of the Director General of Health Services, Dr. Richard Kabanda.
Umugenyi wito mukuru Dr. Diana Twine, observe the protocol. Madam PS, we rarely come to Kazo, apart from being the guest of honor, but this is your district. And it is also a district for our senior colleague Kenneth. I think it is prudent for the leadership of the district. I know Emma introduced the heads of departments, but I think it is better to reintroduce them with their roles and the relevancy to this day. I will not talk about the Undersecretary, of course, is in charge of finance. We have Dr. Herbert Navasa, who is in charge of environmental health. In relation to hepatitis B, we were discussing with the senior colleagues there, and we noted that infection prevention and control is critical. And also given the fact that we are not so sure where people are getting the infections from, apart from the generic routes. Chances are high that we have a big number of our people who may be acquiring infections from saloons. So, Dr. Herbert, I don't know if the ADHO Environmental Health is here. One of the avenues we want to tap into this is to ensure that saloons are highly inspected in the district, Madam PS, to ensure that IPC, or infection prevention and control, is properly adhered to in the district. We don't celebrate having people who are living with hepatitis. Commemoration days are meant to increase awareness and do a lot of advocacy. So, PS, we expect that, of course, for the previous 1 week and 1 week ahead, we expect high levels of increased awareness on how to prevent our people from getting hepatitis. Allow me, PS, let you know that we have listened carefully to the statistics from the district. We are seeing different data from our DHIS2. Statistics from DHIS2 indicate that in the year 2022, prevalence was at 17.9% in Kazo. So out of 3,372 people who were screened, 606 people tested positive. That is a high number. I would like to request the DHO to urgently liaise with our DHI team to ensure that this data is screened. If the prevalence is at 17.9%, that is way too high, and is actually worrying, Madam PS. This very year, from January to June, 1,486 people were screened, and out of these, 246 were found positive, as per our statistics. And that gives us 16.5% in terms of prevalence. That is still high. Madam PS, you may be aware that Kazo has been earmarked to be one of the model districts in regards to promotion of health at community level. we are going to come back here to engage with the districts. We are going to identify community health extension workers. If we have VHTs who are qualifying, they will be given the priority. So we want to identify, to train, and deploy paid up community health extension workers in this district. And there are a number of factors, not because Dr. Dana Twine comes from this district, but if you look at a number of indicators, the results are not good from Kazo. Delivery from health facilities, immunization services. If you look at MWAL, HPV, BCG, Kazo is doing badly. My request, Madam PS, is that as we roll out that program in the district, because we want Kazo and a few other districts that are doing badly to turn out to be model districts, we expect that all sub-counties should ideally have health center 3s. Ideally, because there is no way how we shall be able to compare districts that don't have this program and the districts that have the program when sub-counties don't have health center 3s. So ideally, as the accounting officer of the ministry, that is one of the areas where we should put much of our emphasis. It is also better, Madam PS, to ensure that districts deploy, recruit and deploy parish chiefs in all parishes. They should also recruit and deploy the professional community health workers. Professionals, I mean the health inspectors, the health assistants, vector control officers, and health educators in the district. That should be a priority for us. Because at the end of the day, as the sector, we do not want to see model districts where we are piloting this program getting high numbers of new infections for all diseases cutting across. And also, it is also based on the fact that Kazo and many more other districts that are sparsely populated are given special treatment to ensure that we pilot a program that will enable us to reach out to households on a weekly basis and monthly basis for us to be able to track a number of key health indicators. As I conclude, Madam PS, allow me also to let you know that the sector, with support from partners, has a number of mobile health promotion vans that have been deployed. The immunization van that you have inspected, this is its first route in the entire country. It has started with Kazo. We hope that members of the district health team should utilize. Since we have the undersecretary here, and since the results of Kazo are not doing well, we would like to ensure that we deploy these vans in the districts like Kazo that are not doing well to do aggressive sensitization and also reach out to people at the lower levels. Because we know for a sparsely populated district like Kazo, it may be difficult or challenging for people to move to the health facilities all the time. So we need to reach out to people where they are. So it's one of the avenues where we think that that should be addressed. Lastly, Madam PS, the Hepatitis B unit has indicated to us that Kazo is one of the districts where we have high levels of stigma. That's why it was even difficult to get somebody giving a testimony right from this district. So given the statistics, myth and misconceptions are high. We have data disparities here in the district. So we call upon members of the district to look at hepatitis as one of the diseases of interest to your people. Of course, we are here to support, and with that, allow me, PS, conclude by introducing only the senior colleagues who are here and their responsibilities in regard to this activity, to let members of the district know. Dr. Patrick Tsime. Dr. Patrick Tsime is the Commissioner for Communicable Disease Prevention and Control, and the immunization services fall under him. Dr. George Upento is the Commissioner responsible for Community Health Services, the Ministry of Health. Dr. Ronnie Batungile is the Commissioner responsible for Clinical Services. Those who will have been found to be positive and due for treatment will be directly falling under his docket. For the laboratory, we have Dr. Isaac Sewanyana. Dr. Isaac Sewanyana, the team is responsible for testing. And of course, we are here saying before people seek services, they should be tested in time. Yes, other senior colleagues were introduced earlier. But I'll only reintroduce the head of UNEP, Dr. Michael Baganizi, who is in charge of API services. That marks the end of my remarks on behalf of the DG. Thank you for God and my country.
Thank you very much. In the interest of time, we are now going to invite our Member of Parliament, Honorable Jennifer. Then Honorable Dan will invite the chief guest. Munchereze mbanjure Mayor, former Mayor wa Kazo Town Council, Mwami Nshemereirwe Enoch Rutashorora, mukabantu bakorebe. Twakwakira. Ebindi noje kubyegambira nyoti nkuru. Tokunyisa doctor.
Our chief guest, Dr. Twine Diana, my colleague, Honorable Member of Parliament, Honorable Dan Chimosho, the team that came from Ministry of Health in your capacities, the LC5, the COW, abebembezi mwena aba district ya Kazo mbitinisa byanyu, n'abantu mwena abejizoberi. Erinizo barukuru munonga amazina ni yota Jennifer wabubate muhesi omujokero w'omukyara wa district eje ya Kazo. Intwaro mucyogo kusima mukama munonga ahabwizo barungi eri yatuhereza omu district yetu. Chief guest nyenda kusima omuringo gw'omutano munonga for coming to Kazo on such a day. Yebare munonga, yebare ona nabo no kugabatirirwe ori omunyakazo. Oreke tukigambe ahabo kuba tugomurundu gwo kubanza ihanga ku celebratinga Hepatitis Day konka cyabaho mbunaku bwawe weija Kazo ntukusima munonga. Yebare munonga Dr. Diana. Yenda kusima government yarwangisiriza eyaterereho enteekateeka ngune itwe abanyakazo omu myaka 3 tungire district izoba nkeri yaba celebrated omu Kazo yitu. Ntusima rwangisiriza munonga andageno Yoweri Kaguta Museveni ahabwo kuturwanirira neitwe tukatunga obugabe bwaitu nk'abanyakazo kureba ebituhurira handi. Yenda kusima munonga abantu mwena ahabwo kwija kwanyu. Ahabwo kwa kumukureba hamurebera timu mpango eyargo ministry mbwenu kubahika habakashanga tuturi abantu bake munonga babatakuza kutwara serious. Ebi byone bibagambirwa aha no kuba bareba omujinya gwaitu no kutwejumbiremu ahabwo amagara gaitu. Mbwenu mwebare munonga kwija n'abasima. Ngenda kusima leadership ya district ya Kazo ebembeirwe Dr. konkani njane jakuba natushobora yaba Dr. omuryebi yabi yo bururu yaba biha yaba nkebyo bindi konkani nkusima mnonga ahabwa leadership yawe nenkwatanisa nungerho no kwehayo omyaka 3 kureba ngo district yeitu eriyo nangwa nenda kogana ha district zinde zatandikire yabare munonga abebembezi bagenzi banje mwebare mweyongereyo hanga tuherezo muje yenda kusima ababembezi bamaramizo mwena barya imwe abaturaho numushabira district numushabira government mwebare munonga na hatu mwatera umuhanda mweja mugumizaho mugume n'umutushabira eshara zanyu hanga nazihurura mbweni mwebare nyenda kusima imwe the team that have come from Ministry of Health. Thank you so much. This is Kazo, those who had never been here. This is Kazo. As you've said, I want to thank you so much because you've really known our challenges and you are ready to solve them. I thank you so much and thank you for really endeavoring to come and be here today. Omuringo gw'omutano nyenda garuka nsime Dr. Diana Nomwami Akili. Thank you for representing us in the ministry nk'abana ba Kazo. We are very proud of you and we will not take it for granted. We know that your contribution in that ministry is not too small. It could be the reason why we are here today. We want to thank you so much. Omjenyi mukuru nyenda nkushabe itwe nk'abakazi ntaka kushabire ntwehuriza munonga kushanga ori permanent secretary ekyo maana kitinisa kyamani omunsi omutariho ekintu ekiri permanent shana permanent secretaries nibahirirwe bakatunga ekintu ekyo mbwe ntwenda kusima ngu ori permanent secretary of Ministry of Health kandi ori omukazi kandi akenso norga Kazo nangwa kora yendo rugena burunga. So we want to thank you so much and we are very proud of you. Konka ntwenda kushaba nkushaba mu izina ry'abakazi aba bari aha n'abataro ngo gumo tuconsidering abakazi aba nibabonabona munonga okukira munonga aha bintu byo kuzara ngo kwahurira chairman na kigambo abakazi abamwe tubarkwebasa no kukakugura kasyo ahabo kwakakuza kukamezi mwenda agaba yaconcobize byona mbona gumo tushagizeho otumanye ngu okoko tuturije ogira tabakazi banje otushagizeho kubira abe bitando otushagizeho kubira abe gloves otushagizeho kubira abe kintu cyone kitwetengesa ahabo kuba nomanya orugendo rw'omukazi kuza kwika kuzare kikumanyisa yebare munonga abo kwa nare wakikiriza. When those doctors were talking, I was wondering what is the cause of hepatitis B. But it seems it's not yet known. Or in the due time you will let us know. But I wanted to think about the drinks that are in this world. Hata rhone izireba kweta judge majhurire. There are very many, and in my view, they are very unnecessary. They have caused more harm than good. I want to request that, is there any way that these drinks can be regulated? Because they have caused more harm than good. When permanent secretary na ninshaba na team yawe, I don't know, but I'm just suggesting what can be done to have those drinks regulated. Mutaziha ho bakatwita konka zigiro muri oburyo obuzabamu. Ati barache na mazina gandu kwayo bakazineminga mazina gaitu. Abo kubati ensiano bajeta judge hariyo na kabirita hariye mbogo. Hati you can imagine someone umuntu kubariyo na nyembogo. Mbwenu echo nani nchibashaba nk'abantu abarukureba iby'amagara kureba ngu ekyo nakyo mwakikonsideringa. Omugyenyi waitu omukuru naninshaba ngu korabe wagire kugamba otushoborera kintu kya health center 3 eya Burunga status eyerimu hamwe na nesente zabe ziri zo kugirenovatinga abanyaburunga bagende no bakimanya ekikwaterene nekyo. Omuntu mukuru owa representing Director General, thank you so much. Thank you for all that you have promised. And we are looking forward to have it done here in Kazo. For sure, Kazo, it's one of the local districts. Konkeru kuteka tekwaho wagamba Kazo bateka tekangu iworiyo mumrieze za first district. Now you have special services, but you have seen it, you've seen it yourselves that we really need help. And thank you so much for promising us. We will be with you, we will walk the journey with you, because these are our people and we know what you are going through. Please come and intervene in our situation. Kuyaba nagamba yagamba ekintu kya stigma. Naro kurgaha bakanchebera bakangambira ngu ndwire hepatitis. Nkatuyina kugaruka yo kutunga embazi. Mbwana hati nimba nimpenoha omumazima embazero. Tinkwenda kukira konka research ziriyo nizikora akabatu bakatumarire kimwe matsiko ngu tukuza ngu hepatitis tekuza kutunga mbazi go kutamba. Nari bakakuchebera TB ukanga garuka yo nguyo nitwenshoni kumire mbazi ya TB hatu nimbana muhenoha. Omumazima naninshaba ngwekyo mureke tukyege tushabere hanga tukwate tumanye ngo amagara gaitu and omunsi ntuturo murundo gumwe kwakuba wagenzire noba wagenzire kandi life negumizamu kandi amagara gawe nanaganje nitwe ba manager bago aho kubotari nobotaro mbwene ekyo kumwakubere dangana abakwata ekyo kintu mukireke mumanye ngo tuyine kwerwanaho nobi yakuba HIV nobi zakuba endwara zona embazi nitwe tuyine kujumera ahabo kuba government yehere yo kutuyamba muri ekyo. Nyenda garuka kusima ndakasimire kangambe aha abantu ba VHT. Omugyenyi waitu omukuru abantu ba VHT aba bakozira omurimo muhango. Nambwe naninshaba ngu mbaterera mu ngaro ba VHT abo baine challenges nyingi munonga kurga hantambura kuza hambazi kuza harbyona. Nambwenu omugyenyi mukuru kwa kuza kurgaho ine cyo bagambiro tubaye VHT twaza kubakorreki nangwa no wakujyo tunimije mbarebe nari beje bandebe bo eza bakurebe nari wo barebe abo kwa bakozira umurimo gw'amani nambwe nabantu abana babasima konka they have the limitations kandi nibagezaho obariyaho nabashaho nabakuguna mwene barakino kubahereze byaba professors abo kwemirimo ibakora nemirimo yo mutano mbwene ntubasima munonga mwena himuri ba VHT konka ni mango mugyenyi mukuru neja kuje kiyabagambira abo ko kagende bushani yombi. Nebyo nimbasima munonga abantu mwena baryaha abebembezi mwena aba technical aba political abantu mwena ahabo kubera nizo barukuru munonga omurikazo nintekwa kurugaruka mu nizo barukuru kandi hanga yatugirire mbabazi yaturetera abana beitu kabweitu. We are very proud of them. Kureba Dr. Diana na Akili bariyahangu n'abana beitu nibatukikiriro ministry y'ebyamagara n'ekintu kikuru munonga mureke twengire ombyamagara gaitu ahabo kuba nitwe tugaineho obushoborozi twabantu yambwa government nebyo mugume muhagire NRM ahabo kuba babeire baro ababeire banyine abarkwingana nanyi ebe bikaba bikatakabahoga mugambira abana barukuzarwa n'abazirwe ngu pate emwe yonka erugumizamu nera echa muheru abazeire mugende mushomesa abana ahabo kuba twine aha Diana no kujangwa akashoma mwarebe birunje byatukorra mbwene hati Diana kwarabe nargamu hati hagabwe twine yo munyakazo ndijo orikuza kuzumwanya gwa Diana abo kuba heino butwabere tutakubasa kugira omuntu wene utukubasa kweta izina o ministries ezi mbwene rihanga twigurira omuhanda mbwene mureke tugumize mutushomesa abana okukira munonga ababa kubahingira abakiri bato aba bana bakwera school fees bakazirya bakaija nenda rihanga bakwatse konga mugubene muhagira NRM mukama biherezo muji
twongere ngaro memba wa parliament wetu mucyara yebare munonga kandi abanyakazo ubwo nuwo mucyara oriyo na irukanzia project yo kuhinga omwani ngo abantentasya yongere so ntukusima kandi nemirimo yone yo kutukorra nkamemba wa parliament wetu honorable Dan oyije
omujanyi wetu mukuru PS wa Ministry ya Health Under Secretary Honorable colleague Honorable Jennifer RDC Chairman Protocol yona Commissioners na Directors ba Ministry of Health abari aha Leadership ya ba Ikereziya Father Deo Pastors Sheikh mwena protocol nko kweri eshaza agenda so twine kurawutyaho tukahendera ndafutwara umucogo kubasima aba Ministry of Health no mujenyi wetu mukuru Dr. Diana atwine naningeza ukuru correctinga ubwo nabasa kuba nwe PS wo kubanza urarigire Kazo twaza kwanalizinga je mwenu ningira ekintu kitomeire umwaka gwashatu na mushanje twine government bata PS wo kubanza mwenu mukama simwe now ebintu ebichairman katugunda ya shaba tinka yongeraho ebintu Honorable Jennifer ya shaba tinguza kuongeraho na nyenda ngunyowe nsime Ministry of Health nyowe ngatungo mugisha nakora na Ministry ya Health yebyamagara nakora nayo murago nakora nayo National Medical Stores kunagire no parliament nazaka chiko ka Health ni manye chikumanyisa kuza kubaganisa ihanga buri muntu kwikwirwaro kwikwa panado kwikwa kanura kwikwa nangwa no kubaza condom abo kubantu bazahanuka kidongo bagira ngo bareta nyingi bakizagarake bashangaza hwiremu ushanga abantu nibikarakatsa mwareta size inche mwarete mpango munonga kurigiraho kubanorga mwena abantu aba bintu umurimo gw'amani. I want to thank you most sincerely Minister of Health for the struggle our resources inche munonga kureba nguno mu serving ya ihanga ryeitu kandi mugerezeho munonga mwebare munonga nyenda kubebaza abanyakazo ebintu ebimuntu bitwara nke byaburijo omu mwaka gumwe narebiri kushangana bombeka amarwaro ga health center ya kashatu agarengero muri yashatu tukabandize tubasima tutene n'ikinde kitwayongereho mwebare munonga aguba hundurize aguba kwombeka mutukorera umurimo murungi munonga nambwe ni challenge M18 ningira ni embazi okwecendeiremo kandi naco ni nkimanya ahabwe ncecendeire hariho kota eisente zabuzire completely government kabeta ine sente haba mu kucererwa kongana cyo bariyo bacha addressinga nibageza kureba ngo ba bridginga gap emebazi yayeyongera abanyakazo ndukwendera ekitwine kukora no kukora preventive health okwerinda endwara abantu kurara mu butimba bw'ensiri abantu kuguma aha mukazi wawe omwe kandi waba otakukibaasa omutima kugura remwe ukakozesa kondomu abantu kunaaba omu ngaro mukuza kurya abantu kukora ebisasaizi ahabw'okurwanisa shukaari na pressure n'ezindi ndwara abantu kuba abayonjo omu maka gaitu obuyonjo n'amagara marungi nibitandikira omuka yawe nibiba byaruga kurema irwariro ni nko kwoza omugaragi bakushanga omugaragi buri izooba na motoka yawe waba otaine ekizibu iwe driver motoka niyo kuba ine ekizibu nahabwekyo omu bitukukora byona reka tukyendeze emirundi eitukuza omu marwariro ahabw'okuba tukiri aho ngu n'ekyomurembe ngu iwe buri kanya otaaha irwariro nooba noorondaho ki so turwane munonga turwanise endwara tukukora ebyo ebikurwanisa endwara ebikuretera twagira amagara marungi twakora emirimo yaitu ebindi byona ebikyamaani Katugunda yayashabire ebihonarebo Jennifer yashaba nituza kubikuratirira enyige z'okurabamu nituzimanya kandi naimwe nimukimanya ngu ntuzimanya kandi nezimwe zeigukire ebindi byeizire nahabwekyo abo butashisha yagwaire nyenda ntware eshaaha egi akagishaka a very singular honor and I invite our guest of honor Dr. Diana Atwine agambe nemu mwebare munonga
ninyabuza abangambe orunyankore ninga ngambe orujungu habwokuba ogu n'omukoro gw'ihanga gwona habwokuba message egi tiy'abanyankore bonka okwihaho n'eihanga ryona so munkirize kakye ninja kugaruka omu runyankore konka munkirize kakye ngambeho omu rujungu habwokuba abantu abamahurira bari aha ninga bamwe abakutureba nibenda betegereze ebituriyo ntugamba habwokuba message egi tiy'abanyakazo bonka kureka n'ihanga ryona. So allow me to recognize the protocol, starting with the members of parliament and the leaders of the district in your respective capacities, our senior officials from the Ministry of Health, our development partners, civil society that has been really the wind beneath our wings to make sure that the campaign against hepatitis is carried on continuously. We want to thank you so much. A lot has been said. I don't want to repeat, but I just want to say that from our data of 2020, it shows that 6% of the population of Uganda is chronically suffering from hepatitis B. And over 1,250 deaths have already occurred due to hepatitis B and hepatitis C. Today we didn't talk about hepatitis C, but hepatitis C is exactly also infects the same way as hepatitis B and is also a killer disease. Hepatitis, the difference between hepatitis C and hepatitis B is that we don't have the vaccination, but it can be treated, and the treatment is available except that it is extremely expensive. And so it is not easily available in our hospitals, but it can be availed if you look for it and you have the money. But hepatitis B is the biggest killer in our country, and that's why today, as you heard from the previous speakers, this day was put there to continuously raise the campaign and the awareness of the danger
and the importance of us continuously remembering that this is a killer disease, but it can be prevented through immunization. Once you get tested and you get vaccinated and you complete your 3 doses of vaccination. We introduced the 0 dose, but even previously, vaccination for children had started. And we do believe that the current generation of our young people, maybe 15 years and below, those are protected. But the years above, they are not protected. So it is very important that if you don't know your hepatitis B status, that you go and get tested, and if you are negative, you get vaccinated. The vaccines have been there in our facilities. What is sad about all this is that we've been sending vaccines in our facilities and the medicines expire. The vaccines expire, even medicines for hepatitis B. So we are here to continuously raise awareness, to tell all of you who are listening that hepatitis is a silent killer. Professor Chama, who came to join us today, this is his daily work. He's a professor of gastroenterology. Gastroenterology is all the diseases in the GI, the digestive system, and the liver is part of it. But his daily work and his research has been in hepatitis, and we want to thank you, Professor Chama, for the work that you are doing for this country, and your team that have been dedicated to do the research so that it forms the policy direction and the work that is yet to come to guide the guidelines and the approach to care for hepatitis and prevention. We have done quite a lot of things in this area of hepatitis. In 2022, that's when we officially introduced the 0 dose to all newborns. So all children now who are born in our facilities, even those who come to get vaccinated in our facilities, we make sure that all children, now hepatitis is one of the 14 diseases that we have introduced, and we continue. Even with that, we continue also to advocate for the vaccinations of adults, because these vaccines are available and they are effective, especially those are more at risk. We have seen hepatitis increasing in cattle corridors. We do not know. But I think it is a lifestyle that we need also to focus on. And as Dr. Kabanda said, there is something that we need to research on other than sexually transmitted or other areas of contamination. But we do believe that these salons where people go and cut nails, you are bleeding, you come and another one cuts, that is a source of hepatitis. And we want to really to tell the people that those of you who are going to the saloon to access services, we are not stopping you, but we want to remind you that if the saloon is not observing safe infection prevention, you can actually get hepatitis from the saloon. Hepatitis is highly infectious. It is more infectious than HIV. I was telling people that you can be in the household with someone with hepatitis, and also you have someone with HIV. You will stay safe with HIV person, but you will not stay safe with hepatitis B. I can assure you it is 100 times more infectious than HIV. So it is very, very important that you will take this message. Those of you who have come here today, that don't live here. We brought these facilities here to make sure that you take advantage of the services that are here. You get tested and you get vaccinated if you are not sick. If you are sick, we also want to make sure that your sample is taken for viral load, because to start medicines of hepatitis, we need also to assess your liver, the liver status. And then you start the medicine early enough before it gets complications. We test every mother now who is pregnant. Every mother who is pregnant who comes to our facilities, we test them against all those diseases, hepatitis, syphilis, HIV, and we make sure that all those diseases are not transmitted to the children and also are prevented. We are cognizant of the fact that before there was reusable injections, but now we use single dose injection. We screen our blood effectively, so we know that our blood is safe, so it cannot be now the source of those infectious diseases. However, the biggest now challenge is to take personal responsibility, the lifestyle that we lead. If you can acquire HIV, you can acquire hepatitis B, you can acquire hepatitis C. You have had in 2022, 17% of the people tested here in this district. That is 606 were positive out of 3,372. And that is a big number. And we know that it's just because people are not enthusiastic to come and get tested. Possibly this could be even the prevalence that we are talking about, but we don't know. So we need to see people more proactive and coming through to get tested. So I'm not going to dwell so much on the statistics and how the disease is spread. The previous speakers have already talked about that. Dekangariche ahabintu biche ebya district de ntakahendeire eshaha zagenda mutusasiro kubachereza mwashitama munonga. LC5 chairman hari ebintu byagambaho ebinanyenda ngungambo munyankora kuba egi message yanyu direct, especially abategeeki abo mukichweka. Ekyo kubanza kyabyona ntwenda tukyendeze omwijuro gw'abarwaire omwirwarro omumarwarro gaitu. Omwijuro tukwija abo kuba enamba neyeyongera, population neyeyongera, abakazi nibazaara. Abamwe of course bakozesa na family planning noshanga obwana bwijwiraho nubutembekerana. Of course nimanya ngu egi topic eri controversial some spheres ezimu. Kokito ntwikiriza no family planning kugira abana bawe okaba planning okaspacing oruzaaro okareberera abana bawe bakakoraje n'omukazi nyinenda etachwekyo nkomwenda nko kitenge ky'okukwata okashangaza kuzaara atakubasa neshagama kwekoma akajo akakaba. Ebyo family planning nebyambaho. So obwe population eri kweyongera kumana yeyongera enamba neyeyongera, of course ntujja kureba abantu bengi abakwija mu marwarro gaitu konka kandi ntwenda turebe endwara ezidani yagamba Honorable Chumosho ekyo kugira ngu endwara nshanju na bitana hari 10 abantu abakurwara abakwija mu marwarro gaitu endwara zino zibasa kuzibirwa omaka gaitu. Amaka gaitu ngakora ki kushanga mazima mu district ya Kazongu hariho amaka agataine latrine. Takure ngo ekyo nikemura, takure ngo ni nshwara. Permanent secretary orukurgo mu Kazo district yawe abamwe tubaine latrine. Hata ho numukora ki ba kansara ba ma LC1 no basota kwa LC1 okagira LC1 okashanga ngo mkyaro kyawe abantu abamwe tubaine latrine. Iwe orumuntegeki beshuwo abakozi baitu abatushashure mshara abashemere kwijana barambura maka bakikushanga otaine latrine bakakwata bakakutoma kihome okashashura faini okagenda bakakuha deadline okombeka latrine abo bakazankaye abutushashura health inspectors health assistants bakora ki tubeine mwaha tubeine mpaha bemere mbarebe ninyenda bemere hati mbarebe mukora ki okuba mu district numutungo mushara abantu bataine latrine batakuza mu kihome district naye katunga fine ekatunga NTR ekatunga non-tax revenue okwiho kurgo mu fines imwe mukataho bylaws mwine bylaws tukahinguza kiragiro kya Public Health Act tukine hatukiro mwakozire bylaws kureba ngo burika eine latrine yete ine latrine omuntu azomu kihome kandi kuza kumihayo miliyoni 3 aziteha bamurekure kandi miliyoni 3 izo nazo zikagenda zikakora umurimo gwa district zitarirwe tuine aba assistant health assistants abashemerere kwegesa kugenda bakagumana bagenda kare bantu mwimwe abagurisa bariyaha tumukumanya ngo ba inspector bakabagenda engendo ndeingo koshango baine district inogomwe konka nagendo makana abantu bakiza kwijo makabuzimo oreba abantu bona betereze batinde hati rero hato butwacwiremo obunanko bugombora bwa parish bwa village mazimo bo nibo bukoremo umuntu kurubata akagenda kazomaka akarambara makaka akabuza butandaro akabuza latrine akareba okuba obuyonjo akareba ebyo bikaba bitebyo bikazaye tukaba ecyatutahirire ndware yatwitsire niyo ndikwenda kumanya nejaha ngo tugira gurre ekire kutaraturiya mwe mutwe aba leaders kubata drip tuba infusing seriousness turebe ngu twazibira endwarezi ninyenda kubashomera statistics zanywa abakyara abatakuzara mu marwaro district yengari mubenu mwebembera amine egombora yengari mukwatsire ekikopo cy'abakyaro butaza mu irwaro kuzarama ekyo mbwene ekikopo twakibaha okay Kazo sub county mwebembeire okureba ngo abakyara bono bazowa birth attendant ningano bajaro mbishaka mbwene ekikopo mwakitwara right ntwenda kusima town council yano kuya ngo irwaro rei nibo mukyebembeire muri ekyo nangwa na buremba mukoziro murimo murungi kureba riri ngo abana abakyara banyine bazaro marwaro abakyara bakwija kunywa mbazi baheza kumanya ngo beinenda omumeza ashatwaga kubanza ninyenda kusima burunga nobwera abeteine dekaborekire statistics ziriya tinkubasa kushoma fictitious figures konka ekikumara mani ngu buremba kandi aho abakyara bakugirenda tabakwija kunywa ombazi omwirwaro omumeza ashatago kubanza mbwe nashemero kurengo barida baburemba bariyaha mutuyambe konka kandi remkoma ninyenda kwa congratulating okukirayo kugira malaria mbwene nimwe mukirayo mbwene no conservation ya malaria mbwene remkoma ntubakuritya munonga kureba ngo mukango butimba mbwene nimwe mukirayo kutwara budget ya district yo kuragurira malaria mbwene mwebare munonga mbure mukoma ekikopo mwakitware kya malaria konkana buremba nayo nekurata omwanya gwa kabiri gwa malaria nayo ntubasima kureba ngo abantu okurwaza malaria mbwene conserving obukoko bwa malaria nensiri omukichweka mbwene tubebaza ensiri ni nyingi munongo muri buremba mbwe shati bambe mwaza kukoraje ntwenda kureki mukuza kora kureba ngo ensiri mwakendezaho nabo kumara hakuja ngo murehehi na side ege ya kibare towards kibare muri yo conservation nabo maybe mugambira aba environment tumanye ngo imwe mutumukubasa kwitansiri tumukubasa ku hona shikani mfuhire nte kan tubaha obutimba bwensiri hakabaho abwenchi twine malaria egiyona sub counties ibiri buremba again mwakwate chikope cy'abashwari na pressure yaba ebyo kuriya byanyu yaba numuriya munonga bitakuri yaba niki konka mbweni shukari yo buremba shukari ebeire kindi abarweire ba shukari umuri buremba mbweni yo mbweni riro gamba mazima statistics za buremba mbweni muri abo mutano malaria hypertension na diabetes mbweni really sub county ejo mwine kujiha special attention DHTs muhe attention buremba abwo eriyo negarrenye ma statistics zanyu zone kandi ninyenda no kubagambira ngo buremba abantu aba TB mukebembeire mwakwate chikopo cy'aba TB ni benji munonga omuchweka kandi muri yabo abarweire bona ngukinana na mushanjo hari 10 nubo bari yambaza mbwe twina abandi abariyo no batayayo omunanka abatari hambaza ntwenda kubasima aba sub counties na mbwe nure mukoma bambe 10 bakaraguza bakazambaza bona bashangire bine TB konka basheje ababuremba abaine TB abamwe bakanga kuza gukora ki abasheja TB eriyo na buremba so mwenu buremba is disease conservatory sub county in short mwenu just abbreviation buremba mwenu mwahenda record HPV still ntubashaba kanon kandi kanona herukubi kanon HPV abana abeshi baitu tubakugemwa HPV ni H pylori endwara yitukugema kuzibera kansa eyo muno gwanye nenda abeshi baitu bona abemyaka 10 omashomero gona bashemerere kubaba bona basheme kutunga vaccine ejo kandi baheze yo dozi batakora dozi emwe kureka baheze yo dozi zone zibashemere kutunga kanoni ekikopo ekyo butajema abana ba HPV mwene cyo mwachitwari ekikopo numwebare sirimu engari ekikopo mwachitwara mbwenu mwine kutamwa mana abengari kandi abacyara batakuza kugemesa kandi obone bo tukuchebeza sirimu tukabahane mbazi n'abana babo bakazarwa batakozere ki batarwire mwene baba teyizire mu antinento nikibani kimanyisa ngo tukubachebera nikibani kimanyisa n'abana babo nubaza kurwara bene sirimu nahabwecho nimbashaba ngu ebintu ebyo bituriyo ntukora mu bitemwa amana hepatitis B headquarter na Kazo town kanso hepatitis B ya Kazo mbwenu wano gamba wano mappinga hepatitis B ahere nyingi na headquarter hampa enambe mpanga iba kuchebera bakashanga barwire na home town kansa so nahabwecho na nyenda kubaha just snapshot yebintu ebyo mumanye bantu mwe ngo kuchebeza nubo butandikiro bwo kubaje nambwe nyenda kusima abashaho baitu abamwe barigire Kampala abamwe baha abakoziro mu rumogo gwona gumuriyo numukwa kantu enda kubasima nabaza yo mukakoze so buherezo ubu mukarengwa chebeza mwama kandi nyenda kubashaba ngo mutwikirize ngo ito kutwija twakora nka service nkeze no butukushangora weide taro umuntu wena utukuza kugambira taro utukuza kuzakazindaro nkaha tukajya tumwenu bibangamba twashango inesirimu nga ekintu ntukimba kiri secret kiri confidential ntukulinkinga hakeya no genda no tandike mbaze nahabwe ekyo murebe ngo ebintu ebi services zazi zero mu district nkeza ntonko kutohereze track eje ntwena mukozi mugikozese maximally dekangarcha ha ebintu LC5 yagamba rero mpendere stockouts yes ntumanya ngo stockouts zikiroho ahabwe ebintu bishatu ekyo kubanza enamba yeyongere y'abantu ekya kabiri no government yegenzire ne yongere sentom kugure mbazi tutukakira harebo ahabwa tutwire twine deficit y'amani deficit okwenda mbweno kubasa kutembazo marwaro gate omuntu wena akeja akaraguzwa ateine mbazi gono gwaguzire ntwenda trillion nina kubasa kugura mbazi kugutoma marwaro gona gayihanga konka tukuzityezo esente tuzine so deficit ekiro konka twine bintu bibiri nkabategeki kandi nabantu beito abari umucweka ekimu kubasa kukora ekyo kubanza no kure ntwakendeze ndwara abarwire bacendera twakendeza bakurwara nka malaria mwene nkarwe mukoma yagira umurimo guyakora tukareba ngo esente zitukutom nanka ya malaria yona tukacendeza hata aho esente zo mbwene zigure bindi nizigura mbazi gwa pressure nizigura mbazi gwa kidney then tubasa kubaragura konka hata esente zone zikwira nizihwera omundwara esitukubasa kuzibera ekyo nikimu ekya kabiri nkoko nagamba tukine buzibu nabo marwaro gaitu accountability yembazi ejo accountability ntwenda tuhamye okubarire mbazi yeito yeija omuntu akamanya ati ombazi natungo kwinga guti kandi nakozesa gona taro gwashora taro gwagendo munshaho taro konka gona gwakozesebwaje accountability akatukija kumanya je true need ha tabeireho accountability so stockouts jiro konka na NMS kagira mu buzubu akwesente baka nistura hobundu kwija so ba missingamu na wike mweyonka ne disrupting a psycho yona so shanga mwenu batabasa kureta mbazi obwiro bashemerere twine equipment ninga za fridge bya cold chain na bya equipment bya vaccination konkani imanya nkagezaho na robingana ashababa global funding batwikirize tubombekera ha store konka byagotana byatura twagenda even twagura na equipment ntumanya ntuza kubombekera store konka kubyatura mwento hatu ntubashaba ngo maybe omwirwaro hatu nko tongeyiremo infrastructure muronda ha akizimbe kimwe mu kicwe store tubatere mu equipment eziyambe mbwen ebe store ya vaccines za district mbase kukuma vaccines zanywaha mureke gumana mugenda numuzoko hare kuza kuronda vaccines zibeziroho konkecho nimwe muratu yambe okwa identifyinga omwanya konke ebyome byokosa byebero ntujja no kubibaretera konka tukwenda kubireta tuteinaho kubite mwen so nahabwe cyo muronde store ambulance ntuza kubaha ambulance recruitment ya DHO yes ninkimanya abo kontwire ningamba ntwe nimpandikira bakao ijo tukantu meeting aba health service commission twabashaba twabajya tumwene iki kintu cyo kwekoma ha muntu ngo abaye nemyaka mwenda manya oine kuba oine principal medical officer manya amaziro bwire na akwaro bwire buti. It's not about longevity, it is about the capacity of a person. But somehow we are really stuck on those cake things of, you know, oine kubanzo maremi yake ngahi, oine myake ngahi. Nyokan permanent secretary, nkabandi under secretary, weza yu koram ndebiro mba under secretary. Mweshiti nkozere merumo bantu ninga ndiye chichupuri. So it's not about longevity, because I have seen even people who have been DHOs in the districts and they are disaster. They are just disaster. So it's not really about the time, it is about the quality of a leader. We need now to really get into this. I don't know how, maybe members of parliament, you need really to help us on these so-called public service requirements that sometimes really are hindrance. They are really a hindrance. Because the district would actually identify just a leader. You just look for a leader who can stand and follow through and make sure supervises and, that's it. That's what we want to see. So, when Kao, you write to us definitely. I think you've written to us, and we are going to source for the DHO, the one who can qualify. But where do you get someone must have been principal medical officer for 9 years? What? When have your name? But we shall try. It's not easy. Now, the district hospital, it is not possible. Sorry, we cannot give you a district hospital because, first of all, our guidelines is that the district must have 500,000. Yours is just 200,000. You're not even halfway. So first of all, you don't qualify in our category. But secondly, it's not now a must that every district must have. The president has already directed us in a tough letter saying that it is not about everywhere. Why don't you first consolidate what you have? Because we don't have enough money to declare every district to hospital. This place, if we put a good theater, we put a good maternity, we put wards, we put staff, we have restructured actually in the new structure. The health center 4 is the community hospital now. So you have a hospital, in other words, in the new hospital. In the new structure. You have a hospital, so you don't have to crave for another hospital. You have a hospital. What we need to do is actually to consolidate the gains, but also strengthen the services. Increase the doctors, increase the staff. We have increased now the staffing level from 49 for health center 4 to I think 180 something. So in the new structure. So let us first consolidate what we have because we don't have enough money. What has been a problem, we stretch so thin, we don't have enough money, and we don't make even the services that we have functional. So please bear with us. We know the need, but we will not be able to give you that. But you have a community hospital now. We shall give you a motorcycle for the district, but let it do the work it's supposed to do, not attending weddings and carrying matoke to the market. Because that is the problem. Our infrastructure, our cars, our motorcycles we give you, we always see, maybe not here, but in some districts, it is very painful when you see how they misuse our infrastructure. But the motorcycle, will send the motorcycle to help at least the campaign. Not just campaign, but also sensitization and also reaching out to the people. The scan, we don't have the money right now, but should we get money, definitely Kazo will be one of them. Our dream is to first work on regional referral, general hospitals, then we come to health center force. Then when we come to health center force, definitely we want to equip you with the X-ray and the scan, because we know that even that facility requires both the X-ray and the scan. But it's just that the money is not available. So, as I conclude, allow me to thank you very much. Thank you for hosting us. Thank you for welcoming us. But most importantly, I want to thank the partners and the civil society that have been working together with government to make sure that this campaign continues, and even to come here. We have received support from WHO, UNICEF, Gotv, we have also received support from the civil society and all other friends of Ministry of Health. With those, allow me to conclude by saying thank you so much, but I cannot forget our VHTs. The VHTs, I know that there has been this pressure that we pay. We cannot pay right now because we don't have the budget. We don't have. As you heard from Dr. Kabanda, Kazo was identified to pilot the community extension workers program using the parish model, parish development model. Now it is the thing. It is the new thing on the block. So it's the one all of us are swimming into. So we want to rein on that and also make sure that we come with among the VHTs, those who can qualify, they get promoted to the parish level and they work with the VHTs to make sure that every household is reached, is educated, is supervised to make sure that we do disease prevention. And we shall come back here to engage the leaders on this issue to see that these statistics we've been reading completely changes. Thank you very much. Have a great day.
Tuonjere ubugabo bw'amani abwa PSC kandi umugeni wetu mukuru yebare mnonga kandi nabo muterere appointing sorte ya muronzere nka PS.
Cyanyeba abantu mware ikintu cyanyeba abasheija mbasa kushitama okache abasheija twina abasheija mbedarom abasheija nubangayo muri imwe abayekebeize prostate mwena b'emyaka 80 kugaruka iguru okagiye tinyoni nkora buri mwaka ninkebera PSA ngenda bankebera nzambara bankebera nogu nareba omwe wenka bashatu haza techo chonka abasheija mwatwitsa TB mwatuheza aba barwaire bona bakukira n'abasheija kandi kuba kugenda bakebeza tubakugaruka yo kwakira results. Abasheija tumukukebeza sirimu ekiremeiro mu community nimo mukujubuzi okoso mutuneja kungira besirimu ntugihamiti konka abakazi bokuba kweshanga barwaire bagenda batandike mbazi abasheija tumukutandika mbazi hati hariya haro self testing obunanka obubwa HIV no basara kujyo tukare mwenyo habo badende bweshi robarema wena niza kuzane basakunyesha kubangambira bombaki okay mbwen byabe irebyo fokutunga self testing ogende nayo okay habo kuboine ego mnonga niwe robarema kandi mbwen fokutwara self testing okatware ozoko mukishenge oyesherekire oye testing omanye atrisero kora amanye yerera bujoje bete mucyara nemporanka kwe takwehuraje bwe tuje tukazo mwirwaro tukare you at least wamanyire at least otandi chembaze konka hate kizibu cyeito kitwine HIV tekuza kwaho TB tekuza kwaho abasheja muremeiro makaganyu mutakoraguza mwebare mnonga
PSA yatwizira so yebare mnonga onchirize nyete tusime organizing committee mwena mwebare kandi nshabe Reverend Father oje otwereze shara omukoro gwahwa konka mwongere ngaro zamani PSC abantu bateka ngo noza kureta ebigambo byo kuba weweta konka yebare munongo kutugambira amazima kandi na status y'endwara okuzemereire omu district yaitu kandi ngira ngo n'umurimo gwitu nk'abebembezi kureba ngo twazagumizamu okusensitizinga community yaitu aha ndwara ezo zona ezibatugambira no kurigirira amagombora gaitu okugemerere. Mwebare munonga.
Mwebare munonga. Twafuna eshara nituza kufuna anthems in reverse order. Reverend Father yamara kutuha eshara then tuhendera omukoro gwitu abamahuriro abakwenda interview hari PS nimwe muza kwetereza bandi yamara okutera anthems. Mwebare.
Mwebare by MC. Before the final prayer, I also want to thank you, PS, for choosing Kazo to be a district that could be an example in fighting against hepatitis B. When I was living in Europe, especially in France and Germany, this was a condition that you cannot enter into their country without testing hepatitis B. And now since it is coming here in Uganda, I do really appreciate and specifically choosing Kazo. Nkakoraho niyo mironde mingi kunawe nintura karama yo nakundire. Konkeche nabanze kukunda kabazana ari omukazi w'ekibuno kyangu. And just this lady natamuchi. I came to understand Unonyamati. So when I look at you, ninga kuna gambe chabwa faza mwakangarano. I cannot also admire. I have that responsibility. Yes, I look at you, I admire, but I admire and stop there. I don't advance. Webare bintu waturagansa kandi watereza ukochera kuja kutufuyurira omwanya gwona abwensiri in Karama kandi mahatu warangwa ensiri n'ekizubu omurikazo nja kuja ku approachinga mpora nakyo ekizubu kya Kazo kyo kwitwa ensiri abantu eje wagambe mushoija ekyenderi then n'ekindi ebintu biwatereza ebichairman witu yashaba nabyo ntibikusimira kandi ubu nakora niwe okotaka bagamwana w'ekishuba. There is even a time when you gave me 500 million cash. Ejo chanyoreka ngo uryo muntu w'umwesugwa kandi umurungi. When you are appointed permanent secretary, I became so much happy. Kandi nabanda abakugamba huko binimba nyenda ngumbatere konkashanga ndufaza. Mwene x-ray watugambira na skani motorcycle ku increasing staff yitu from 49 to 100 and plus, okutereza doctor wa witu wa DHO hanuya, ambulance, vaccination equipment, hati katugunda wasigara kuzaba health center maraka bakakuriyetinga kashenje. Onecho najyo twarobwire. Ningira ngo umwaka ico cyahwire. Mwendo benotebekanza kuti equipment mama. Then tuzakushaba abandi bakora accountability nibo wagambaho konke chance asa no kugira ngo hepatitis B yo mu Kazo town council is too much. Mwe nahora najiro ubwoba kandi nshaba nacyo tukoreho turenga twabasa okureducinga ebintu ebi. I'm not a speaker of that day. I was just invited to give a prayer, and I want to call each and everyone to have this special blessing. In the name of the Father, and of the Son, and of the Holy Spirit. God Almighty Father, I want to thank you for this special function. We thank you for choosing us, Kazo, to be a district to experience and give experiment for hepatitis B, and also to choose us to be the leaders in fighting against it. We thank you for our special guest, Dr. Diana Atwine, our beloved permanent secretary in the Ministry of Health. And all the entourage that she came with, all the people that attended, our beloved MPs, our beloved leaders of this district and the society at large. May you, Lord, increase our faith, increase our spirit of work, that what we are told here may be put in practice, and let us be creative enough to fight against these common diseases that are trying to eradicate and also evade our life. May Almighty God be protector of us, protect you as you go back, lead your head aside and up, and then continue to serve our nation, Uganda. We ask this through Christ our Lord. The Lord be with you, and Almighty God bless you, the Father and the Son and the Holy Spirit. God bless you.
This brings us to the end of our commemoration. Thank you for coming. I remain Emmanuel Ainebiona, Senior Public Relations Officer at the Ministry of Health, and my colleague, the Speaker of Kazo Local Government. The members of the press, where do you want to station? I will tell them to stop. Press me. Where do you want? That's far. You will not control.
got me. We got something everybody else can see.